Good afternoon. Maybe just a minute. Good afternoon. There we go. Good to see each and every one of you here. You know, you never know if people will really show up. So it's really good to see you. And I know after last week and the cancellations we had to have, I know I've had not many, just a couple of people that really are probably not even related to the issues that we're talking about, but saying, you know, we can't do this without those hearings, people out in the general public, but we can. And one of the main reasons I feel good about doing that here particularly is because this committee is so dedicated to making sure to vet the causes that y'all are bringing forward and to make sure we are informed as we go into a quick decision-making process, no doubt, to get the amended out. And then we will gather again in just a couple of weeks and go much deeper into detail as we talk about the 26th. So, my name is Katie Dempsey. Welcome to everyone. It's good to be here. We have at least one new committee member with us, but if we could at first, let's just take a minute and let Representative Donahue, if we can start with you, and I'm going to navigate the mics kind of quickly here too with Amber's help. 27. Okay. And introduce yourself and tell us where you're from so everyone knows.
Representative Emery Donahue from District 31, represented 12 years of Flowery Branch and Oakwood in Hall County. Now I have Hall County, Talmo, Pendergrass, Jefferson, and Brazelton, and some great new constituents. And a lot of old constituents that I still represent.
Okay.
Representative Victor Anderson, District 10, which is most of Habersham County and all of Rabun County.
Where is it?
No.
Represent.
Let's try that. Well, try that.
Representative Mike Cameron. I'm from District 1. I have all of Dade County and about 3/4 of Walker County in the northwest corner of Georgia.
Okay, and next.
24.
Gotcha.
I'm Mary Margaret Oliver from DeKalb County. There are 16 of us that represent DeKalb County, and I'm one of them.
I'm Karen Mathiak. I represent District 82, which is Spalding and Fayette. And there's not 16 of us, there's only 2 of us.
Well, I'm going to say great afternoon to everyone. I'm Representative Lydia Glaze from District 67, which is part northern Coweta and the farthest south end of South Fulton. It's a pleasure to join this great and esteemed group.
Thank you so much, and I'm so glad to have each of you here. In the back of the room, I believe there is a sign-up sheet for anyone who might wish to make public comment later, too, in the hearing. So if you'll make sure to add your name to it, we would appreciate that. Before we get started on the work, if y'all will just pause with me for just a moment, let's bow our heads. Dear Heavenly Father, we come to you this afternoon to thank you for the health and the wellness that we are all experiencing here, and to ask you to open our ears and our eyes and our hearts to these very, very special needs that are soon to be presented to us. Walk with us today and give everyone that is here today a huge hedge of protection as we all journey the roads of Georgia and beyond. In your name we pray. Amen. Amen. Okay, so thank you. Y'all are ready and waiting, and I appreciate it. We're going to start with the Department of Human Services, Commissioner Broche. Thank you so much. I'm going to turn that mic.
Okay, can you hear me? Okay. All right. Good afternoon, Madam Chair and members of this committee. I'm Candace Brose, Commissioner of the Georgia Department of Human Services and Director of the Division of Family and Children's Services. With a presence in all 159 counties, the department touches the lives of more than 2 million Georgians every year. DHS has approximately 9,500 employees and over 230 offices statewide with 3 divisions: Aging Services, Child Support Services, and Family and Children's Services. We oversee programs like adult protective services, child protective services, foster care, public guardianship, refugee resettlement, child support enforcement, and benefit eligibility, including Medicaid, SNAP, TANF, and more. Before I get into the governor's AFY 25 recommendations, I want to highlight some recent agency accomplishments. Given the governor's and the legislature's historic investments in the state's workforce, we've continued to see improved metrics for recruitment and retention of quality personnel. Right now, our agency's overall turnover is 2.5 percentage points lower than this time last fiscal year. And for all but one of our frontline workforce categories where turnover is equal compared to this time last fiscal year, turnover is lower across the board. In the Division of Aging Services, through our program to assist Medicare beneficiaries with navigating access and coverage, in state fiscal year 24, we more than doubled the amount of out-of-pocket expenses saved and increased the value of legal services provided to older Georgians through the Elderly Legal Assistance Program than the prior year. Georgia MemoryNet added 3 new memory assessment clinics, bringing the total to 7 located in Atlanta, Albany, Augusta, Macon, and Gainesville. We also received more adult protective services reports and substantiated more investigations in FY24 than FY23, and we served more vulnerable adults through public guardianship. The division's FY25 budget is over $133 million, with just shy of $84 million in state funds. In the Division of Child Support Services, where we collect and disperse financial assistance to children and custodial parents, we saw a higher number of participants in the fatherhood program, which helps non-custodial parents who've fallen behind in child support avoid court intervention, and that higher number directly benefited over 1,000 new children in our state. Through our parental accountability courts, we also collected more child support last fiscal year than state fiscal year 23. Last year, DCSS distributed over $690 million in financial support to 406,000 children. The division's FY25 budget is $150 million, with a little over $34 million in state funds. In the Division of Family and Children's Services for child welfare for state fiscal year 24, we conducted more CPS investigations. There was a lower median caseload, and we served a higher number of children without foster care entry than state fiscal year 23. We saw a lower median caseload for foster care case managers. In calendar year 2024, we finalized 1,306 DFACS adoptions, which is 45 higher than the prior calendar year. As for hoteling, where DFACS has been forced to place a foster child in an office or a hotel because no suitable homes were available, we have maintained our success. In 2022, we were forced to house 1,007 children in hotels. In 2023, that number dropped to 712, and with the support of our legislators, providers, and foster parents, in 2024, we were able to reduce that number again to 235, which is a 77% reduction in 2 years. You'll recall that from my prior testimony that our average number of foster youth staying in a hotel or office on any single day in 2022 or 2023 was between 60 to 90. In 2023, the highest number of hoteled foster children was 95, and that occurred on July 6, 2023. Last year, the highest number of foster children in a hotel was 19, and that occurred October 14, 2024. The overall average per day was 7. Some counties and regions have had long stretches where no children from their area spent the night in a DFACS office or hotel. And if we must place a child in a hotel or an office these days, it is a true emergency. It's usually because a youth needs inpatient care or residential treatment and there are no open beds, which DFACS does not control, or it's because a teen was released from juvenile detention, their parents have abandoned them, and they have serious criminal charges, so it's tough to find a willing provider. Lastly, it could be a middle-of-the-night situation, and we don't know enough yet about the child to know what they need to safely place them. To better serve children in our care with the most complex needs, We've partnered with Murphy Harps to pilot the first Qualified Residential Treatment Program, or QRTP, earlier this month. This new program type will provide trauma-informed, therapeutic, out-of-home care for some of our most vulnerable children. We've also launched the Special Victims Unit to collaborate more effectively with federal, state, and local law enforcement to find missing children, including missing foster youth, to work together on complex or multi-jurisdictional cases involving human trafficking, CSAM, otherwise known as child porn, and exploitation, and to safely recover dozens of missing kids, including through statewide recovery operations. We employ specialized CPS investigators, foster care case managers, technology developers, and a sworn officer, with several eager to join our ranks. And we've built and in some cases repaired relationships between our agency and law enforcement across the state to better serve vulnerable children. The 5 programs that comprise child welfare have a budget of $1.1 billion, including nearly $637 million in state funds. Over in the DFAC's Office of Family Independence, comparing FY24 to FY23, we had more children and seniors enrolled in SNAP. In FY24, we hired 1,085 caseworkers to help people enrolled in Medicaid, SNAP, WIC, and related programs, and launched new retention programs. And we successfully administered Disaster SNAP, or DSNAP, to help those impacted by Hurricane Helene. To get DSNAP up and running in affected areas, we had to find and absorb over $11 million as the states matched to draw down federal funding, and we hope to work with federal and state partners if possible to obtain reimbursement. The Disaster Supplemental Nutrition Assistance Program provides eligible low to moderate income households with one-time payments to help buy groceries due to lost income or damages following a disaster. It also provides a supplement to existing SNAP households, offering them the maximum allotment for a single month. A person's DSNAP eligibility was based on whether they resided in a county where then President Biden had issued an individual or public assistance emergency declaration and if they met income eligibility. This effort was first of its kind for our agency regarding geographic scope and eligible households. We ran DSNAP in 4 phases over 5 weeks, starting October 21st, 2024, and ending November 23rd, 2024. In terms of total impact, the numbers are remarkable. Across 55 counties, we dispersed over $126 million in benefits. We assisted nearly 267,000 households, and we served over 598,000 individuals. The FY25 budget for the Office of Family Independence is $595 million, with just over $159 million in state funds. As a whole, DFACS has made modernization to technology to better serve Georgia families a priority. We've updated Georgia Gateway to more effectively route casework to staff for more timely benefit application and renewal processing. Last year, DFACS also launched Communicare, which is technology designed to connect child welfare caseworkers, court-appointed special advocates, foster parents, and biological parents. We are also modernizing some of our internal systems and processes to be a better partner to our providers. In October, we launched a pilot with a web-based invoicing portal for our room, board, and watchful oversight providers with the goal to improve payment, timeliness, and accuracy. We've also begun the task of scanning and digitizing decades of paper financial records in our county offices, beginning with over 1 million pages of records in our Metro Atlanta offices. Those are just a few highlights of our recent agency accomplishments, and we are very proud of our work and commitment to serving Georgia's families, seniors, and children. Now going into the governor's recommendations for amended state fiscal year 25. Here you can see totals for the governor's recommendations for amended fiscal year 25 and fiscal year 26. There are no statewide adjustments for AFY 25, but there is a little over $3.76 million recommended in program-specific adjustments. Starting on page 4, I believe, of your track sheet, line item 28.3.1 under child support services with $5,771,558. There is one-time funding to cover Georgia Technology Authority mainframe costs. In accordance with the governor's directives, we'll soon have all of our applications moved to the cloud for better security and significant savings. In the interim, this funding covers GTA's expenses for time-limited use of existing mainframe technology. On the same page, but under Child Welfare Services, line item 28.4.1, the governor has recommended a little over $1.7 million for court-appointed special advocates. Last year, seemingly out of the blue, then President Biden's U.S. Administration for Children and Families said we can no longer use our TANF block grant for Georgia CASA, despite years of partnership using that fund source. This funding plugs the hole to prevent service disruption for thousands of children across our state, advocacy that is truly life-changing for Georgia's most vulnerable youth. Under Departmental Administration, line 28.6.1, there's a reduction for $1,088,000 regarding a multi-service building in Coweta County since building is not yet underway. On line item 28.6.2, there is $1,468,800 in an increase for technology to further integrate Georgia Access and Pathways, the governor's health initiatives, into Georgia Gateway, the state's integrated eligibility system. In Elder Community Living Services, on line 28.8.1, you'll see a reduction of $225,000 to effectuate a funding transfer to the Department of Public Health, given their ongoing work in this area. On page 5, line 28.10.1, there's a yes caption to utilize existing funds to enhance Medicaid disability evaluation capacity. We have contracted for more clinicians to review medical documentation to get these more complex cases moving faster. Following another abrupt federal policy change, we had to upend how we processed Medicaid disability determinations. Basically, overnight, we can no longer rely on part-time contractors, physicians, to help us review those new applications. And because they could not handle the volume and we had to develop new technology, we are putting more resources into this area. To close the gap, we have now contracted with 2 medical service providers to work backlogged cases for disability determinations. And fortunately, with resources, we believe that we'll be able to work through pending cases by the end of the state fiscal year. We support the governor's recommendations for amended fiscal year 2025, and we humbly ask for your support as well. At this time, we would also request additional funding in AFY 25 to address growth in out-of-home care, which is our program budget where we fund the state's foster care system. Across the nation, every government child welfare agency is experiencing significant growth in foster care expenses as more children with more complex needs enter care. How government child welfare agencies fund foster care, where a child is placed, how the placement is funded, services, health care, and more is complex, but it's a combo of Medicaid, Title IV-E of the Social Security Act, federal block grants like TANF and the Social Services Block Grant, and state or local dollars. In addition to federal and state dollars, our nonprofit providers, those who manage foster homes on our behalf, run group homes, or offer services like transportation, counseling, and more, also heavily rely on charitable fundraising to stay afloat. Inflation has been incredibly difficult for them. It remains tough for them to recruit staff, and skyrocketing insurance premiums, for example, are making it challenging for some of our providers without whom we cannot survive to keep their doors open. I have previously testified about the reality that more children are entering the state's custody with complex needs, particularly mental and behavioral health needs, which translates to higher costs for where we can safely place the child and the services that we, a healthcare provider, or a juvenile court deem necessary. In addition to those real-life challenges, the math behind how we pay for the foster care system is convoluted. For example, outdated income formulas in the federal Social Security Act put Georgia in a uniquely bad position, even compared to our neighbors, in terms of eligible foster children from whom we can draw down 4E federal funds to pay for their care. And fairly recent changes to the same law also imposed restrictions on how long we can use 4E funds to pay for congregate care or group home placements. If a child is 4E eligible, which represents about 34% of children in our care, we can only use 4E funds to pay for their group home for 14 days. unless the facility meets a statutory exception. And up until recent months, none of those facility types existed in Georgia. Within the past year, though, we've launched 2, but they are still new, and traditional group homes may be the only option for some children in foster care. Once those outdated federal formulas combined with group home funding restrictions, it created a hole in how Georgia funded foster care, and that hole has grown as more children enter custody and with more complex, expensive needs. COVID definitely played a role in this surge, although child welfare officials everywhere are still trying to calculate true cause and effect. If we cannot use federal funds, Medicaid, 4E, TANF, or SSBG, to pay for foster care expenses, we must use state funds. We do our best to run projections and plan, but we do not know how many children will enter or leave our custody on any given day. And for those who enter care, we cannot fully predict their needs. We nonetheless have a statutory responsibility to meet those needs once they reach us. After we submitted our projections for out-of-home care based on FY24 expenditures, we realized a $44 million deficit in state funds once we received updated fiscal year quarterly projections. We meet kids where they are. Courts order services, clinicians, counselors, and therapists recommend specific treatments, and we cannot unhouse or unserve children to get out of the red. We cannot ignore recommended or court-ordered care without harming the child and risking contempt. We cannot jeopardize child safety by sending them home too early. We cannot place a child in an inappropriate setting to save cash, and if we cut provider rates, it might force them out of business. Simply put, growth has exceeded our base funding. Our current AFY 25 deficit is $44 million in state funds. We believe that it is the most accurate forecast given year-to-date expenditures, what we know about the children in our care, their placements, and service needs. Although we've been able to leverage some federal fund sources to plug smaller deficits in recent years, it will not be an option this time. Right now, the primary cost drivers behind this deficit aren't eligible TANF expenditures. If we get too creative, we risk the entire block grant. If we yank state funding out of contracts generating third-party TANF maintenance of effort, we also risk the entire block grant. We fund hundreds of millions of dollars using TANF for some initial foster care placements and other foster care related expenses, but we cannot use TANF for what's generating this budget hole. And honestly, even if those services were eligible, we do not have the available funding in TANF to cover a shortfall this large. Under residential child care licensing, line item 28.14.1, there's a yes caption to utilize existing funds to hire a dedicated employee for implementation of 2 license types following recent changes to state law. Our agency licenses child placing agencies, child caring institutions or group homes, maternity homes, and similar entities. State law was recently amended to add license types for qualified residential treatment programs, QRTPs, and commercial sexual exploitation recovery centers. These changes are important because, as previously mentioned, federal law limits how long government agencies can use 4E funding for eligible foster children when we place them in congregate care or group home settings. There are exceptions, including what we have now codified as QRTPs and commercial sexual exploitation recovery centers. We have executed a contract, again, with Murphy Harps in Cedartown, Georgia, to pilot the state's first QRTP, and the first child was placed there a few days ago, with additional children placed in just the past couple of days. These facilities will be a vital resource for children with complex mental or behavioral needs, especially those who need to step down from crisis stabilization, partial hospitalization, or psychiatric residential care, or those who need certain therapies for sexual exploitation or trafficking before they're placed in a community-based environment. Over time, the state will be able to draw down significantly more federal funds to pay for foster care for eligible children. And with that, I am happy to take your questions.
Thank you so much. That's a great, quick overview of some pretty intense work.
Thank you.
Y'all have been doing. I thank you. You know, I think when we hear about certainly the disaster, SNAP, and the recovery that I know y'all have been involved in, that is very powerful. And I'm very impressed with the numbers of hoteling that have gone down. I know we want them to always be zero, but this is so much better. So thank you to you and everyone who works on that, taking care of our very, very vulnerable children. So we do have some questions. Going to start right here with Representative Oliver.
Good afternoon. We've discussed the vacancy rate and turnover rate. Is it accurate to say your turnover rate is still over 40%, almost 44%?
No, I don't believe that it is. I'd be glad what I can do to show you the full numbers for each of the categories and in a more detailed slide deck. I can send that to the committee.
If it is 43.4%, wouldn't that mean that your vacancy rate would be higher than the retention rate? I'm just worried that your vacancy rate might be 50% now.
No, ma'am, that would not be accurate. So what we can do, I think if we share that slide deck with you, it will show you that we're actually doing quite well comparatively, especially coming out of COVID in terms of reducing attrition. And of course, we thank the governor and the legislature because so much of that is directly attributable to the pay raises.
You have created a new work effort, I'm not sure what to call it, called the Victims Recovery Unit.
It's the Special Victims Unit, yes, ma'am.
How much new money have you appropriated for that within existing funds?
None. We have absorbed the cost of bringing in this additional capacity, and really the goal was to make sure that we had a more dedicated resource for law enforcement of all types to assist in cases, given the significant overlap between the cases we work and crimes against children. And the unit has been incredibly successful, even though it hasn't been quite up and running for a year yet. There have been dozens of missing foster children recovered, and that's included several statewide recovery operations, most closely in coordination with the FBI.
You're referring to it as a law enforcement unit, and you're seeking arrest powers. Is that arrest powers by whom? To arrest whom?
So right now, there's only one person that has exercised responsibilities associated with a sworn officer. None of that has been related to an arrest. It's generally more detective work. So he has been deputized by the Fulton County Sheriff, which we're deeply grateful for his support. What it's meant literally for us is that whenever a child in foster care goes missing, we previously had to solely rely on finding a law enforcement agency that would be willing to execute exigency warrants in particular, which are emergency warrants to ping a child's location through known social media accounts or phone numbers or email addresses. If for some reason we can't find an available or willing law enforcement agency to do that kind of work for finding one of our children in its significant volume, then we just have to rely on maybe a member of the public making a report of that missing foster child or some other means for us to recover the child. But having that in-house sworn officer has been incredibly helpful because they can do the exigency warrants firsthand. But also what we're finding is that, the entire time I've been at DFACS, I've had some pretty persistent complaints. One of them, and understandably, is that law enforcement sometimes needs that middle of the night extra resource in addition to traditional channels to reach DFACS. And so that's been something that's been really helpful too, is building that relationship or repairing it statewide so we can work hand in hand.
One of the problems, and it's a legitimate problem, very much so, is that law enforcement officers don't issue warrants. Judges issue warrants. So I can't figure out why you say they're issuing warrants, because they're really not.
There are specified and they're really special procedures for exigency warrants, where essentially what they're doing is asking Meta primarily, which is Facebook and Instagram, to provide information about one of the children in our custody's most recent login information to help try to triangulate their location and be able to recover them safely. So I'm with you. I had the same sort of initial confusion, but my understanding is that it's a process outlined. I'll find the citation, but I think it's in federal law where officers can pursue an exigency warrant for those particular purposes.
In DeKalb, the magistrates work 24 hours a day, but they don't in most counties, so that's kind of part of the blockage for you. If I may, one more question. I'm getting, maybe others are, a lot of emergency calls today about the federal blockage of money coming out. I'm told this surely can't be true, but that there's some kind of freezing going on based on your eligibility gateway computer. Is that true today based on the federal action of the last 24 hours?
So we've been working since the minute that we got the initial memo from OMB to try to assess the impact to our agency. There was a press conference, it may still be ongoing, I'm not sure, that had started around 1 p.m. today, and an additional OMB memo that was issued to clarify, at least for now, that Medicaid and SNAP are not affected by the pause that's been issued. I know there are several other grants and programs that we're awaiting more guidance on, and for those, we're just going to continue to wait to see the expected impact and any clarity that can be provided. But we did, getting that clarity on Medicaid and SNAP especially was very helpful for us, because we were fielding calls too.
So we're not really sure yet what the impact is. It's kind of...
Correct.
One final, forgive me, Madam Chair. Your reunification rate, children back to families, is dropped significantly. Why do you think that's so?
Do you mind sharing what data set?
64% decline of reunification within a year with the family.
Do you mind
foster
sharing what
care
data set you're looking at?
I'm looking at your performance measurements.
Okay. Well, in terms of non-reunification, I'm happy to take a look at the data that you're looking at to see if we can provide additional context. I will say there's often a misunderstanding among members of the public as to what role DFACS has in taking custody, what we do in court, whether our decisions carry, operate as final word or not. But these decisions are made in a system. So we go to court, we work alongside child attorneys, parent attorneys, court-appointed special advocates, guardians ad litem, and the court itself, and ultimately the court has the final say. So in terms of non-reunification, happy to provide more context if I can look at it, but I think that's something too, that it might be that in certain areas of the state that we're not reunifying because of a court's decision not to go with that recommendation. But I can't be sure without seeing the data set.
I'd be happy to look at other data about that. Thank you, Madam Chair.
Thank you. To what you were speaking about the funding that's in question, could that possibly impact the PSSF grants? I've gotten some questions about that. That's the one that I'm hearing.
I believe so. Yes, promoting safe and stable families.
Yeah, it could. So the providers that are concerned about that right now have reason to be concerned right now.
Yes.
And we'll lean on y'all to help us navigate that as soon as you can. Yeah.
In the most recent memo that was issued, there was a line that said quite clearly that if payments are required under the law, that they cannot be paused. And so for a lot of these, even though it still will be helpful to get a more finalized list, and something more concrete in general, that gave us a lot of comfort in knowing that that may be coming soon, and that we have some more, that it's not as in jeopardy as we immediately suspected.
Good. Thank you. Okay, next question is from Representative Donahue.
Thank you very much, Mr. Chairman. Thank you. You've worked really hard, and I appreciate that. And I want to tell you that the question last year I asked was, how do we spend $1,500 on a motel room? Could you go a brief summary of that? And we've lowered that to where a lot of people ask, but they really, as I had no clue why we were doing that. The second thing, I want to make sure if we could go back on 28.4.1, did we, CASA, which is an amazing program. And when I say that, it's about 70% private. I support it and other people. Did you say Biden took away the money, the administration? And is it not true that about 70% of CASA money is funded individually?
Right. So I'll start with the explanation of the cost of hoteling. So $1,500 generally will come down to the actual cost of the room plus what it takes to feed the child, transport the child, generally have a behavior aid, sometimes more than one, which have hourly rates associated with it. So when you combine all of those factors, that's where you get around $1,500 a day, although it can be more if there's property damage associated from the child's stay in a hotel, and there often is, unfortunately. We are tremendously grateful for the legislature's support in making investments so that instead of spending $1,500 or any amount in a hotel or office stay for a child in our care, we've been able to put that money into getting it directly to our providers who can provide safe, quality homes for these children. And that means, too, that we've had flexibility to negotiate rates to meet that specific child's needs. Going to your question about CASA, so for many, many years, and there are plenty of other providers and nonprofits where we use the TANF block grant to cover their services. There has been, I will say, a push in this most recent administration, or most recent outgoing administration, to pull back how we spend some of those TANF dollars. And Georgia is somewhat unique in how we spend TANF compared to many other states, given that we spend so much of it on foster care related services and placement. But at the same time, it's never going to be a good move to get just an out of the blue reinterpretation of a longstanding contract by federal regulators who say you can't continue using it for such a vital resource. And that's exactly what happened. But fortunately, the governor's now recommended that funding to plug the hole.
Thank you.
Representative Cameron.
Thank you. Thank you for your testimony today. I'm just following up from last year on local offices, staffing and availability of hours. Do you have any update on that?
I do. So we have,
Thank you.
as I mentioned, I think it's 233 total offices statewide. So that means we certainly have more than one office in each of the counties in some places. We have moved. We are still in a tiered reopening posture, so we'll share the updated maps for you so you can see the DFACS offices and their hours by region, the child support and aging services related offices by region. But at the end of the day, the reality is we are still struggling to bring in staff that can run those front desk operations. And so we are not operating fully Monday through Friday standard business hours for the DFACS lobbies at least. And again, we'll circulate those maps so that you can see, but that continues to be an issue. Now, people will, that we have appointments available, so that's been very helpful, that if people will make appointments, and of course, any day of the week at a regular business hour time, we're gonna make that work for you, but there's still some offices that just aren't open completely for walk-ins.
Thank you.
Thank you. Are there any other questions or comments from the committee? Yes, Representative Glaze.
Well, first of all, I want to say thank you for a great report of what I've heard so far. I do have some questions, and please excuse me if they're more simple than anything else. But in reference to your group home funding, it sounds like that Title 4E is where that is located to pay for those, and it's only up to 14 days. Is that correct?
Yes, ma'am. So for 4E, the formula is even more complicated perhaps than the other ones that we have. And so when many years ago now, when welfare reform occurred, states at that time were still going to have eligibility for 4E funding to pay for children in foster care tied to the income of their parents at the time of removal, plus some other factors that play into the overall formula. What it meant, though, is that because at that time Georgia had quite low income thresholds compared even to our neighbors, we're still held to that standard. And so so year over year, what we've seen is because Georgia's economy continues to do well, especially in recent years, you've just seen fewer and fewer children be even eligible to draw down 4E funding because of that outdated formula. We have been putting a lot of resources into trying to fully maximize all of the 4E funding, though. So we've been able to kind of hold that line, whereas years we've seen the degradation of pulling it down. But then that combined with federal changes, I believe it was in 2017, for the federal Families First Act. It did want to incentivize states to move away from group home settings for children in care, which is understandable. If you can place a child in a foster home, that is going to be a great resource, a family environment for that child. It works well for them. But what it meant, though, is that they capped for those children that managed to pass the 4E eligibility formula. If you only have a group home available, and every state has struggled to keep foster homes, keep group homes in their ranks, then you're capped at that 14 days to pay for their stay. After that, it's state funded. And that's really been a crunch for every state. It's not just one that Georgia has been dealing with.
So can I safely say that group home funding is not an option when we have emergency situations of students or kids going into a hotel and or possibly an office that can't be used instead? It can't be interchanged?
Well, we actually, because of investments just in the past few years by the governor and the legislature, we have been able to get more funding that's state funding. So we aren't as reliant on drawing down that federal fund source. We can use state funds to try to find the best possible placement for the child, which has been really great to negotiate literally with a provider. If you're willing to take this specific child so they don't stay in a hotel or they don't end up in a hotel, can we send a behavior aid? Can we pay for extra therapy? So we'll negotiate that rate. But that's been because of flexibility in state funds, and it's still something that in terms of 4E federal funding, the state has got to continue to roll out these new license types. Otherwise, the traditional group home, you can't fund it using 4E for more than 14 days.
Okay, and then last question is, first of all, I want to say thank you for the disaster SNAP that was provided. I do wonder, though, are we going to be able to apply to get those funds back through FEMA? Because they're disaster relief, we should be, as a state, able to go back and to recoup those funds. And will those funds come back into your budget?
So for the $11 million that we found, and in order for us to get DSNAP up and running, that represented the state match. And so we believe that there may be some flexibility through GMA with one of the governor's recommendations that if this process proceeds as we think it might, then we might be able to apply for reimbursement through that recommendation of additional funding in GMA's budget. As far as FEMA, I'm not sure that will be available to us, but I think through GMA we may have an avenue.
Yeah, I think it's an opportunity to have it explored. FEMA does have the disaster SNAP available, and it is part of what we would call funding that would come back to the state if the state applied for it. I work for FEMA part-time, and that area is some work that I do.
Yeah,
so hopefully we can go back and recover some of that, and it can draw back down into your agency, hopefully.
And this is Melissa Barwick. She's the DFAC CFO. She may have a better answer. Sounds like she does than I do.
Yeah, I'm sorry. I should have put this in your packet, but we actually, our deadline to complete the application for FEMA reimbursement is on Friday. We've been working very closely with them since the day after the hurricane. Unfortunately, they are not able to cover any part of DSNAP, as that is a federal program run by a different agency. So what we're working on them for is reimbursement of our DFAC's regional employees. When there are hurricanes, we staff Red Cross and emergency shelters on behalf of the Red Cross, on behalf of GMA and the EOC. And so we are working with them to get that overtime reimbursement for our team members who worked those shelters until they were able to mobilize, but they're not able to cover the DSNAP cost, which is a much more substantial cost. So.
Thank you for your response.
Thank you. Any other questions or comments? Or Commissioner Brose, any other closing comments that you have at all?
Just thank you for your support, and if anyone has, I know there's some items we need to circulate, we'll be happy to do that, get that to you quickly. And if anyone has any other questions, we're always available to you.
That'll be
Thank
great.
you.
If you'll just get that information to Amber, she'll get it out to all of us. I appreciate it so much.
Thank you.
Thank you. Next up, we will hear from the Department of Behavioral Health and Developmental Disabilities from Commissioner Kevin Tanner. We'll Get them set up here in just a moment.
Madam Chair, while he's loading that, I'll just tell you, I sent you a text with that latest memo from the President's office that outlines some of that might clarify it for you.
Thank you.
You're
We'll
welcome.
dig into it as
Thank
well.
you.
Appreciate it. And if everyone will remember, there is a sign-up sheet in the back if you are here to make some general comments when we finish the hearing. Thank you. Whenever you are ready.
Well, thank you, Madam Chair and committee members. Appreciate the opportunity to be here representing the Georgia Department of Behavioral Health and Developmental Disabilities. We touch a lot of lives in Georgia each year, and I want to thank you for your commitment over the last several years to be able to continue to see increased funding, increased programs, to be able to impact Georgians who are very vulnerable in an impactful way. So I want to first hit on the governor's proposed amended FY25 budget adjustments. You'll see that some of these are just going to be very straightforward. The first one is removing $375,000 in state funds with other funds for the expansion of hepatitis C screening services. And then going into our adult developmental disability services, reducing funds for the Macon Center. If you recall, and Madam Chair, you were there for the groundbreaking, this was really an initiative the House led on relating to the center down in Macon that's going to be the state's first IDD crisis stabilization center. We'll talk more about that in a little bit, but that's under construction and it's going to open at sometime in March. So the amount of funding that you budgeted in the FY25 budget, we're not going to need that full amount. So the recommendation is to reduce that. So we still will have the funding necessary to open it in March and operate it this fiscal year, but that's just a reduction. And then under adult forensic services, you also provided funding for a program in Dodge County, an RYDC that we took over and renovated and added 30 additional beds for restoration services. Again, that has now opened. We're up and running in that facility. We are bringing in our first patients, but we are overfunded for that for FY25 by the $436,920. So again, we will still have all the dollars we need to fully operate that for this fiscal year, but there is some savings there that can be recognized. So thank you for that. And then the transfer there at the bottom, transfer of funds from Georgia State Investment and Finance Commission to the Department of Behavioral Health. Those are some dollars that were appropriated, $500,000 for to study and to plan for a new BHCC, Behavioral Health Crisis Center, to be located in the North Fulton area. Fulton County has property there, and they're doing a center, and that funding was appropriated in the FY25 budget. And it was in the State Investment and Finance Commission. That's just being moved over to our agency because we have contracted with Fulton County to do that work. So next slide. All right, so that concludes all the items, pretty straightforward items in our FY25 budget as proposed by the governor, but I did want to give you an update on a few key items, and we just mentioned this one. This is our rendering of the building that's currently under construction in Macon. We're extremely excited about what this is going to bring to our services. You probably, and if you've been in the General Assembly for some time, you have, and especially if you have an emergency room in your area, you have probably received a call from an emergency room about someone who's in the ER that has an intellectual developmental disability that they're not able to find placement for. Many times these individuals have a now comp waiver, which is something that our department runs. One of the things that I have really challenged our staff to do is we have been really good at being firefighters. We can put out a fire. So if you call me with a fire, we'll find a solution to it. But we want to become fire preventers and start preventing these fires from occurring. This is a major step in that direction for this population. When someone finds themselves in an emergency room that may have an intellectual developmental disability, they may also have behavioral issues, they may almost many times will have a medical condition also. It's very difficult to find a provider, a community home that will take that person from the ER. This will be 16 beds, inpatient beds, that we will have open to bring individuals there to that center to stabilize them. We will have all the doctors and nurses and behavioral health therapy therapists that can provide both physical health, mental health, IDD services there at the center once they get stable, and they'll typically stay here around 90 days, and then they'll be transitioned out to community placement. The other thing I'm very excited about is we have entered into an agreement with Mercer Medical School, and we're going to have a very robust outpatient center at this facility in Macon, and Mercer Medical School is going to operate that. Now, I'm excited because if you know Dr. Jean Sumner and you know the great work she's done all across Georgia, what I'm also excited about, though, this is going to be a training institute. So she's going to have her docs come through in training, come through this center. They're going to learn how to take care of a very specific and unique population. And then they're going to go out and be doctors all across Georgia, and they're going to work in rural parts of the state. And we're going to have a robust telehealth program here, too. So as these doctors go across Georgia and they have someone in community, instead of that person possibly having to come back to the center for an inpatient bed, they'll be able to serve them in the community. So we're extremely excited about that. The other thing that we are also working on is we have up at Avita in Hall County, where Representative Donahue's at, we have some swing beds at the Crisis Center for IDD services. We're looking to add a couple of more BHCCs around the state with 6 swing beds that we can use for IDD crisis services. But we're also working on a community residential model that I'm extremely excited about. We opened up 2 of these homes over in Augusta, and these are for individuals who have behavioral issues that just don't fit well, and we can't find a provider to take in a normal 4-person group home setting, or they may have a medical issue that prevents them from being in a traditional 4-person group home. So we opened up, and they're operational. We have 4 beds in each home, a total of 8 beds in the Augusta area, and we have 24-hour nursing care. And what I'm excited about is we were up to around 40 people a day being stuck in emergency rooms. That number is not, we're not happy about the 20 that's there now, but we've cut that number in half over the past few months. We're in the process of working with River Edge in the Macon area. We're going to open up 2 additional homes. And we also received approval from CMS. So this is one of our new placements. We have 3 total types of homes that we've created for the more intense individuals. We identified that we probably have in our system 200 people across the state that would fall into this category. But these are all community settings, but they will allow us, and I have challenged our team to have all this set up and operational within the next 2 years. Most of this will be done within this calendar year. But at the end of 2 years, it's my goal is to have 0 individuals in an emergency room, and we'll be running on autopilot. So this will be up and running. This is going to become a national model. We've already had several states Zoom in and want to meet with us about what we're doing down at Macon, and also some of the other placement types. So we're extremely excited about that. Also excited about what's happening down in Savannah. You funded a child and adolescent crisis stabilization unit. You placed $15.5 million in the amended FY24 budget for construction. You also placed $125,000 in the FY25 budget for operations. We had the groundbreaking there. We have a new CEO at Gateway, Ashley Allen. We unfortunately lost Dr. Mark Johnson after a battle with cancer. Ashley Allen, who is someone he personally had brought in and talked to me about that he wanted to be his replacement. She's doing a tremendous job. That project, as you can see, we broke ground. It's under construction. It's going to be a 16-bed facility, and we are excited to see that facility get built and open in the coming next year. So you've heard me say this, and one of our people asked me, what's one of your biggest challenges at the department? It's obviously the fact that we have almost 800 individuals currently in jail waiting on a hospital bed. So those calls that you're not getting, if you may be getting those ER calls, but you're probably also getting calls from sheriffs who have people in jail waiting on a hospital bed. We have 641 total forensic beds in Georgia. Out of those, 60% of those are taken up by individuals who are there not guilty by reason of insanity. That's an individual who may have been charged with a crime such as murder. The court has determined they're not guilty by reason of insanity, and they've ordered them to come to our state hospital. They stay there for a long time, many years. We have individuals that have been with us for well over 20 years in our state hospitals. By 2034, we predict we'll have 0 beds available in our state hospital for the forensic population because we're adding new people each year not guilty by reason of insanity. A recent study by A&M showed that we had a 232 bed gap in forensic patients. So it is challenging. Currently, our wait time for males is 367 days from the day we receive the order till the time we're able to get them in. So I'm excited about what we have done to try to alleviate some of that backlog. We have worked hard to try to create space. This facility here that you see us standing in front of, this is the Dodge County Jail Restoration Facility. It is a YDC that actually one of your colleagues, Representative Danny Mathis, called me and said, we've got a YDC in my community that's vacant, that's not being used. It's a great building. It's in great shape. I went down and visited with Danny, visited the building. We talked to the DJJ commissioner, and we were able to work out a transfer of that ownership to our agency. We spent some money, renovated the facility, and we have now opened it. And it is being operated as a jail-based restoration facility that we're providing. Our team as the security and our team is the clinical team. We've never done this before in this manner. We've started moving patients in, and we'll be moving patients in, and we hope to have it full by the time you gavel out on April 4th of session. So we're excited about this, and these people come directly out of jail into a place where they can receive treatment. So we're excited to see this moving forward. And you all have funded that for us, and we are very appreciative. So one of the things that I would like to do, I was asked to talk about the opioid settlement, so I want to put that other hat on. But before I do, if it's okay, Madam Chair, I'll be glad to take questions from the DBHDD perspective, and then we'll talk about the opioid trust. I'm the trustee of those funds. That's outside the role of being the commissioner of DBHDD, but I appreciate the governor's willingness to put that in our agency and to ask me to serve as trustee of those funds, and I want to talk to you about that. But before I do, I'll be happy to answer questions about our agency.
Are there any questions right now? I do see one from Representative Glaze.
I'd like to go back to line 15.51 in reference to the BHCC, Fulton County. How many beds will be in that facility?
It's in the planning phase right now, so we have no operational dollars. I would anticipate it'll be similar to what we've done before, 24 beds with a temp ops. But again, there's no operational dollars associated with it.
And are there operational dollars coming from Fulton County itself to complete the project?
No, not currently. What happened in the past when Fulton County, as you know, is the largest county in the state, and they didn't have a crisis center at all. And you all funded one in Fulton County, which we're paying, the state's paying the operational cost, but Fulton County put in a considerable amount of money to help with that project. We've had meetings with the county manager and others to talk about the need for one in North Fulton to really catch that Forsyth area, that Cobb area and the North Fulton area. We have a bed study that was completed by A&M, and it shows that we needed 5 additional crisis centers in the metro area, and that would obviously fill one of those spots.
Well, we thank you for bringing that to Fulton County and getting that on board.
And I know
getting it started. We've got the one in the south area.
That's right.
That's open.
And I know you'll find a very willing partner with Speaker Pro Tem Jones on that also,
Yes.
because she's talked to me a lot about this facility.
Thank you.
Thank you.
Okay, I don't see any other questions.
All right. Well, let me give you a quick background on the Opioid Trust. Some of you may be more familiar with that than others. Again, I'm going to take off the Commissioner of DBHDD hat and put on the trustee hat. So we are, Georgia, along with other states, entered into some litigation against manufacturers and distributors. And Georgia was awarded a $638 million settlement. Those dollars will flow into the state over the next 18 years. And that sounds like a lot of money, and it is a lot of money, but you also have to kind of look at how those dollars are broken out. 25% of that, or $159 million, is going directly to local participating governments. Many of your governments here were engaged in that lawsuit. I was a county manager of a large county, and we were one of the participants. So 159 of the 638 million will go directly to those governments, and they'll determine how they're going to use those funds within the terms of the settlement agreement. 75% of the funds then will go through the trust, will flow through the trust, $479 million. That's made up of $91 million from the manufacturers. That's going to be paid over a period of 9 years. And $388 million from the distributors. That's going to be paid over 18 years. So the money is going to come in over a period of a number of years. It's important to understand that when the settlement agreement was reached, there was a lot of conversation around the tobacco settlement, where money came into states on the tobacco settlement, but it could be used for anything, and all states used it for anything. So this settlement set up in a very restrictive way to try to make sure that states and local governments spend the money in the way it's intended, which is to prevent future harm and to reduce harm from the use of opioids. So they list some approved uses, which include medication-assisted treatment, naloxone distribution, support for mothers and babies that have been impacted by opioid addiction, programs for those who are incarcerated because of opioids or people who are coming out of incarceration, harm reduction techniques, or data collection and analysis and research. So there's a strong emphasis on making sure those funds are not misused. Part of my job as the trustee is to make sure that all of those funds are distributed and used in the correct manner. So talk a little bit about the governance structure. There was a lot of negotiation when the settlement was reached between local governments, the large governments in the state, the small governments in the state, et cetera. So that's how you got the regional structure. Each of the DBHDD 6 regions of the state have what we call a Regional Advisory Council, or RAC. And the way there was really no specific language in the agreement of how those RACs would be formed. It just said, I think it was between 3 and 7 members appointed by the local governing bodies. And that was the extent. So we were getting a lot of telephone calls from local governing bodies, local commissioners and cities saying, what do we do? So I reached out to ACCG and GMA and asked them if they could help take the lead on this, because it was not our place as a state to make those determinations. They did a tremendous job. We got all of our RACs elected. and in place. They're all 7 members. They all have a sheriff. They all have someone from the courts. They all have someone from a community service board. And I'm happy to also report that every single one of them has someone with lived experience. So that's very impactful for our community we serve. And then at the state level, there's what we call GOSAC, or and that has been appointed. Half of those members were appointed by the governor, and half of those members were appointed by the local governments in the state. In addition to that, we have what we call qualifying block grantees. Those were the 5 big governments in the state. That is the city of Atlanta, Fulton County, DeKalb County, Gwinnett County. So don't think I missed anybody. Those are the Cobb County. Those are the 5. So the way that works is when we release funds, whatever percentage that local government should get of those funds, we just send the funds to them. They make the determination. They appoint their own RAC. They determine how those funds are going to be used, but then they have to report back to me as a trustee on utilization of those funds. So all of that has been put in place. We contracted with a private group, and I gave some pretty unrealistic expectations of when we were going to roll out grant funding. Our team stepped up, and they're laughing behind me, and I hear them. And they did a tremendous job, and we were able to open up grant opportunities, and it was all electronic. We have a website, which you may see in a minute, that you can look at. It's got a lot of information, because one of the things that I wanted to make sure that we did was we wanted to understand what do we need to be spending money on in the state. So we did a gap analysis, and we looked at what services need to be available throughout Georgia. And if I'm from Habersham County, or if I'm from Dade County, or DeKalb, or Hall County, or Fulton, or wherever I'm from, or Rome, what services are available in that area, and what gaps are in place. So all of that's located on our Georgia Opioid Trust website, and those are the things we're encouraging people to apply for grant funding. So we opened up the grant opportunity, and we received a tremendous amount of interest, a lot of grants. It went through the process, and we have now all the RACs met. They reviewed their regional grants. They made their recommendations. The statewide advisory group made their recommendations. We have now finalized and sent out letters of intent, and at the 1st of March, we plan to send out the contracts for people to execute and get the dollars on the street again prior to you leaving session this year. And we also plan to open up a second round of funding in April. So we have a lot happening around this area. We are planning to release $50 million in the first year of funding in the first round, and we will plan on releasing a similar amount next year. So we're excited about that. I will also tell you that we received $250 million worth of requests, so $250 million for $50 million actually released. I'll quickly tell you total approved projects. We have 128 projects approved, 79 are regional projects, 49 are statewide projects. Year 1 regional projects funded 14.47 million. Some of those projects we allowed them to go up to 2 years, so total funding for the 2 years in regional projects, 21.61 million. Statewide projects, year 1, 28.93 million, with year 2 being 19.78 million, for a total of $48 million. All total for 2 years, $70.32 million that'll be released. I think one of the things I failed to mention to you, the other thing that the trust agreement, the settlement agreement specifically says, is that 60% of the funds will be for statewide efforts, 40% will be regional, so 40% are determined at the RAC level, and then the 60% the statewide level. So this QR code, if you want to scan it, will actually take you to our Georgia Opioid Trust website. It has a tremendous amount of information. and I would encourage you to take a look at it. If you've received phone calls about these dollars, let people know if they're interested that we're going to be releasing grant opportunities in April, and we're excited about that. These grants are being awarded to a whole host of individuals, and as I look around, I'm almost 100% confident there's a organization, a company, someone in every single community represented on this committee that's going to be receiving grant funding. We're also going to be going around the state doing some opportunities and inviting you to attend those, where we're going to do some contract signings and some other things, so we're excited about that. Madam Chair, I tried to give a whole lot of information in a short period of time, but I'm happy to answer any questions.
Thank you. You did very well, and you did give us a lot of information. We do have some questions here from Representative Oliver.
I'm really grateful that you talked about the trust fund, because the significant way this is handled, differently from the tobacco money. I could talk a long time about those you haven't been here. I mean, the tobacco money was not managed with this kind of precision and strategy, and it's still an issue at some point we'll discuss. There is a list of other opioid cases that are on the way. And each one of these cases is going to be managed differently based on whatever settlement documents get worked out between the litigants and approved by the court. For this committee's perspective, that's something to be thinking about, and you'll give us updates on what kind of progress might be made, and we can anticipate other money. That's a source for our districts. Another source for our districts is leftover COVID money, leftover ARPA money. There's a list somewhere about how much money Floyd County has and Fulton County has that's unspent. I mention that because the crisis bed crisis is something that I'm thinking about a lot for DeKalb County. DeKalb County has put $15 million on the table in order to entice crisis money from the state. So all these money sources we ought to be thinking about in terms of solving this crisis bed. And the opioid settlement list of cases coming is something that gives us perhaps maybe an opportunity. So thank you for that detailed analysis.
Thank you. And I'll just say to that, I'm kind of taking off my trustee hat and putting on my DBACD hat again. We really went through and looked at any ARPA dollars our agency had, and we wanted to make sure we got the highest return on investment when we spent those dollars. And I'll just give you one quick example. Going back to the IDD conversation, one of our biggest challenges is how we collect data and healthcare information from all of our providers with our IDD providers. And our IDD Connect system, which is our technology platform, just doesn't function well, and no one likes it. So we are, Brandon's team's leading an effort. I think we've awarded a contract, and that entire system's going to be replaced at the end of this year. And I just got out of a meeting with some of our friends at the Department of Justice that we have worked with on a regular basis, and there's a lot of excitement around that system being replaced and what that's going to mean for the state and our ability to serve individuals in a better way, but also track the data in a way to show that we're serving individuals in the right way.
Well, thank you. Thank you for the information.
Thank you.
If we have questions, we'll be in touch. This is
Thank
strong
you.
for us. We appreciate you.
All right, everyone have a good day. Thank you.
Thank you. And next, as we switch over, the next presenter will be Darcy Robb for the Georgia Council on Developmental Disabilities. Thank you. Let me get one for Amber and Lydia here too. Let's just put that one and then give me one. And then, thank you.
I know. Okay, thank Thank you. Okay. Yep. Frustrates me. How are you?
Give me just a minute. Let's get Amber back. Here she comes. Just a minute. Hope you are. Okay. Thank you for being here with us today. Why don't y'all introduce yourselves too? I know we've got a couple of committee members that just ran out to grab a bottle of water or something. Let's go ahead and get started.
Sure, understood. It's great to be with you all again. Thank you for this opportunity to present. I'm Darcy Robb. I'm the Executive Director of the Georgia Council on Developmental Disabilities. And thank you for this opportunity. And this is one of my members. I'll let you introduce yourself, Thais.
Hi, I'm Thais Kaiser. I am a parent of 2 individuals on the spectrum. I'm also a member of GCDD, and I'm a supporting parent, also known as a CPSP.
Thank you. I'll go ahead and get started on our presentation today. So at GCDD, our mission is to bring about social and policy changes that promote opportunities, and that's for the wide spectrum of people with developmental disabilities to live, learn, lead, work, play, and worship in their communities right here in Georgia. This is one of our favorite pictures. We can't get enough of it. You will see these are our 9 new members being sworn in by the governor this summer. They were appointed by Governor Kemp. We are an independent state agency. We are administratively attached to DBHDD. But part of what makes us so special is over 60% of our members are individuals with developmental disabilities or family members. So here at GCDD, we do receive some state funds for inclusive post-secondary education. And I know many of y'all, of course, Madam Chair, Representative Donahue, I believe you've had quite a few visitors from this crew before. Hopefully all of y'all have. The bulk of our state funds are for inclusive post-secondary education, and that is so students with intellectual disabilities can get higher education along with their peers. That is a shining example of success in the state of Georgia. I will have you know that I and 2 of my colleagues, one of them an inclusive post-secondary graduate, we had the opportunity to present in Washington, D.C. this summer before 13 other states and territories who were asking us, how have you done inclusive post-secondary in Georgia? What can we learn from you? So that was fantastic, and we could not have had that success without you. Many of these students will be here at the Capitol at our first Advocacy Day tomorrow. We've got over 150 advocates signed up. So some of y'all will be getting visitors, and you should all see our folks being recognized in the gallery in the morning. So something to look forward to. All right, let's pivot to budget. Y'all have been very generous to us with the support for inclusive post-secondary programs. That is the only source, that is the only state program that funds directly go through us for. So we have nothing to ask for ourselves in the amended fiscal 25 budget. But we do want to strongly suggest that you reconsider the amended 25 funds for one of our members' top priorities, and that is now in comp waivers. You can see what I've included here is from page 16 of your tracking sheet and what you just saw with Commissioner Tanner. So in the amended budget for DBHDD this year, there are no additional funds for now or comp waivers. We think this is a really important moment to grow this investment in amended fiscal 25, and I want to take a moment to talk about why. So, what is a now or comp waiver? A now or comp waiver, as I know most of y'all are quite familiar with, that's a tool. It provides services to Georgians with developmental disabilities so they can live in their homes and their communities, not institutions. So a waiver is also a tool that allows these Georgians to, and their family members, to work and contribute to their communities. It is very hard to qualify for a now or a comp waiver. Only Georgians with significant impact of their disabilities will be found eligible. I have an update as of today on these numbers. You see I've got an approximation sign on the slides that went to Amber this morning. The most recent numbers are that we have 13,711 Georgians receiving now or comp. On the waiting list for Now or Comp, we have 7,916. So those are the most updated numbers you can have. I said it was hard to qualify. As a point of reference, I want to say that now that is not all the Georgians with developmental disabilities. We have almost 250,000 families here in Georgia that are supporting someone with a developmental disability. But our standard for qualifying for Now or Comp is high, which is why you see those waiver numbers are so much smaller. So one of the reasons I raise that to you is because when someone qualifies for a waiver, here in Georgia, that's a very serious thing. That's a sign that they really do need support. Now this fall, GCDD was very happy to be part of a process that was led by DBHDD along with the consulting group Guidehouse. And that process was looking at how to better manage and ultimately eliminate the waiting list. Now, I know that the hope was for the Guidehouse report to be ready before session, and I understand that team is in the process of finishing it now. But I thought it was a really fascinating process, and I wanted to share a bit of what we at GCDD learned in that process. So something I really appreciated about the way DBHDD and Guidehouse did this is they included a public listening session, and that was on October 8th. And in this public listening session, you had Georgians with intellectual or developmental disabilities, and you had family members, and they were just speaking about their experiences. So not state agencies, not organizations like mine, just everyday Georgians were invited to do this. I was sitting in the background, and I was furiously typing notes, and so that is where this information is from. I imagine that all of you have heard probably many times over that it is very difficult to get a waiver. We very much heard that in the session, and I just thought a few of the comments were very telling. You can see up here on the left a woman by the name of Sarah who has a brother with Down syndrome who's 61 years old. She said getting on the planning list has been unbelievable. We had Bridget over there on the right whose child had just been awarded a waiver. But she talked about the difficulty of the process. You can say the way she described it was it's been the most arduous process I could have imagined. The one that really got my heart, frankly, is in the middle from a woman by the name of Priscilla. She has a 19-year-old with a rare genetic disorder and intellectual disabilities. And she said, "I cannot tell you how many times I have been told to make noise 6 months before he graduates. How many times we've been told residential care is off the table till we, his parents, are in crisis mode. I've been told this by people working in the system. No family should be told their best hope is wait till you get a crisis to help." I realize this is hard to hear. I realize this is not what any of us want to hear. But it's important information, and that's out of the mouths of Georgians, so I wanted to share that with you. And I have to tell you that is unfortunately something that we hear a lot. People get waivers when they go into crisis is the story that we hear. A bit more from the listening session, and appreciation to Charlotte Densmore on my team for creating this visual. So another of the people who spoke in this meeting was a woman by the name of Debbie. Her son was actually denied a Now or Comp waiver 3 times, told he was ineligible. And she had an interesting solution. She actually hired someone. This is a cottage industry in our state, apparently. She hired a comp application professional, paid this individual $1,000 to work on their comp application, and she reached out to your colleague, Senator Brian Strickland. Then they received the waiver. Sarah, there on the bottom, they do not yet have a waiver. This is the woman whose brother has Down syndrome in his 60s. And she explained that their story, as y'all know, back when folks were born in the 40s and 50s, frankly, nobody thought that anybody with Down syndrome would live very long. Well, we now know that's not the case, and folks are getting better support. But when he was a child and a young man, their parents didn't think that they should apply when he was young. Because at the time they were able to support him, and frankly, well, that was the expectation. So their parents, of course, are long gone. Sarah is now trying to support her brother. She's been trying to navigate the process of getting him a waiver. I do not know what agency or what person, of course, said this, but at one point in the process, she shared that she was told that someone would get back to her in 48 hours. She did not hear for 6 months. Currently, he does not have any services provided by the state or an agency, and his sister is paying out of pocket for his care. I don't know how long that can last. Again, I know this is not news any of us want to hear, but I think it is important to hear it. Okay, so some facts and figures to consider. Not all states have a waiting list for their DD waivers. We can't end this. And when I say a waiting list, I want to make it really clear. I am not saying, nor is my agency saying, that every single person on the list needs a waiver tomorrow. We know that's not true. What we're saying is that when a reasonable person would look at the person and look at the family and say, yeah, you need help. You know, the parent has quit their job to support you. 80-year-old grandmother is coming over every day to physically move you around the house. Parents calling another parent advocate and saying, I'm suicidal, I can't get help. That's actually happened to the lady sitting beside me, that she gets those calls. That is the point at which a person needs a waiver. And I truly don't know how a reasonable person could argue against that. Okay, so back to my official slide here. Not all states have a waiting list, and some of our peer states here in the Southeast have made a real effort to cut their list down. Tennessee is currently right around 1,000 folks waiting, still a waiting list, but a lot less than 8,000. Oklahoma, they have a really neat online dashboard, and they have a goal that they're announcing to be a, quote, no-wait state. So they want to get to that point I was talking about with y'all of when a person needs the services are there. They've cut their average wait time from 13 years to 2 years. And their goal, again, is to get to the point where when the services are needed, they're there. Now, of course, everyone is different. We know that, right? I will tell you that high school graduation is frequently targeted as a time when most folks are going to want to start their waiver. Some folks might need a waiver before if there's really significant issues, and some folks are okay for a while after. But that's a pretty common benchmark in the world of developmental disability, and you can see why, right? The person's out of school, you don't have IDEA anymore. So that's kind of a benchmark. Now, the data that we reviewed in the Guidehouse sessions this fall, at that time, the data that was shared was that 74% of the people on Georgia's waiting list were 21 or older. I will tell you, I again have just updated today data. That number is 68%. Okay, so it's just a little over 2/3 of our folks are 21 or above. In other words, the point at which we typically say, yeah, most of y'all need your waiver. Another issue that was talked about in the Guidehouse sessions was the determination of need score. And that's a score used to essentially look at how badly does this person need a waiver. One of the issues, and I understand the report is going to address this and hopefully give us some solutions, is that right now the department is looking at, quote, unmet need as opposed to actual need. And as that's been explained to me, and again, you know, this is something explained to us at GCDD, as I understand it, if a parent has left work to care for their child, that is considered a need that's been met. So it's a different way of needing to look at need. The way the Guidehouse project leader put it, that it does not account for the urgency or the severity of need. Now, I would argue very strongly, and I think most folks would understand this, that if you've got a parent leaving work, that's not okay. That's not acceptable. We shouldn't consider that met. That's desperation. So that was something really valuable to come out of the process, really needing to look at how are we determining need, and is it what a reasonable Georgian would say is need. Another issue that came up, and this is something that, again, my member Thais has helped me understand better, families and people on the waiting list do not know what their own need score is. We've talked to multiple folks, and I will tell you, I've not found one person who knows what their score is. In fact, they don't even know that a need score is a thing, that they don't realize that this is a process of determining when they're going to get their support. So something that was good about this process was all this came out, and I'm very hopeful that that will help us do better. Final fact to consider, you all, along with your colleagues, along with the governor, invested in the Now and Comp Rate study last year, which was so necessary and we are so grateful for. But now that we've invested in our providers have talked about they are able to build up capacity. So now that we've invested in our providers, we've gotten them out from underwater, we're now at a great time to invest in our people. So our recommendation is we recommend funding 1,000 new now and comp waivers in the amended fiscal 25 budget. That's going to be $27 million, so approximately 1,000. We know the need is there. We know providers are building up capacity, and we recommend moving on this. We are furthermore going to recommend having 1,400 new waivers in the fiscal 26 budget. That would not end the list, but that would get us to the 2,400 waivers that were recommended by the Bipartisan Senate Study Committee. And again, if you look at those numbers, we have well over 2,400 folks that are out of high school and that could use these services. Before I open it up for questions, I'd just like to offer my member, Thais Kaiser, a few minutes. She works on the ground with families, unpaid, and she has some really valuable perspective that I thought you would find valuable.
Hello, it's nice seeing you again. I actually spoke in front of this committee last year, so thank you for having me back. I think the worst part of the lack of waivers, it actually falls within the families and the individuals, because as a family member of an individual, you struggle mentally, physically, and you give everything that you have just to support your individual. Again, I applied 4 times. I was denied. I actually had to sue the Department of Behavioral Health. I got the waiver this past year, and it's been a struggle even once you get the waiver, trying to figure out how to work it. There's a whole process after that. But I'm thankful that we're here. Because of my experience, I have doctors that sent me their families. They're like, hey, Ty, can you help this family out? So that's how we kind of started a few years ago, and I currently have over 80 families that I support on my own. I don't have a business. I don't take money from these families. My whole goal is, hey, strengthen you, you're strengthening the next parent. So it's kind of building that chain, right? We help each other out. And what I do is I help them kind of navigate the services. What do you need to ask them? You know, like the assessment needs. I didn't know what it was until recently after I had the waiver. And then I started asking the families I do know, and over 10 of them said, I have no idea what it is. So then I had to explain it to them so they are aware. So there's not a one-stop shop for these families. You get the best support from other individuals, from other family members. Again, I've had a ton of people say, Ty, start your own business. You can make a lot of money doing this, but the reality is I don't have the heart to take $1 from these families. Most of them, by the time they get to me, they are burned out, they're suicidal. So, and I talk to an average a week, at least 2 parents. New parents that were sent to me by different psychiatrists, different psychologists, people that I've worked through. I mean, even some agencies, I've had individuals be sent to me by the Department of Behavioral Health. This morning, I received a text message from a family member, and I would like to share this with you. She says, hi, Thais, I hope all is well. You know, I always start off by saying I hate to bother you, but I've come to a very crucial conversation on how to overcome what I find to be an impossible decision. I have to find another living opportunity and placement for Devon. She is a great kid in so many ways, but my health is rapidly declining. The family is deteriorating. No doubt, there's a lot of pressure on us. But I spoke to my family, and we've all done what they could over the years. They're all adamant that I can't do this anymore, and they're 100% in agreement. I reached out to Kaya Babida to set up an appointment to get through the Now in Comp. I have emailed the Emory psychiatrist for resources. Do you have any resources? So these are families that reach out to me, and what I try to do is I try to find them services. I try to find them different doctors. I will connect with each and every person that I know that I've somehow has come across my path the past 5 years since I started through this journey to get my son's services. It is heartbreaking, and most of the phone calls, not only are they depleted, you deplete a little bit of yourself every time you speak to one of these families. You know, you just lose a little bit because you want to give them hope, but you know what the process is like. Again, and most of them don't have. I am fortunate enough to have a husband that makes a decent living that allowed us to sue the Department of Behavioral Health. These families don't take it over 85% of them are single parents. Most of them work multiple jobs. So they don't have the time to do the research. They don't have the time to even self-care, you know. And again, I am not a mental health care professional, but I am trying to learn as much as I can so I can, again, connect these individuals to the right people to help them. But I am one person without any resources to do this. So I'm hoping that you guys will take these words and my story into consideration and provide the waivers for the families that are in need.
Okay. Thank you all so much for your time and attention. We are happy to take any questions.
Thank you, and thank you, Thais, for sharing your story. Did it well, again. Appreciate it, and it's just hard to even say how meaningful I know it must be for those families that you're helping, so thank you for doing that. Are there any questions or comments from our committee members? I can't see. Representative Cameron, sorry.
Thank you, Madam Chairman. Thank you, Thais, for your comments. I'm just curious about the frustration level build up where you had to file a lawsuit. I mean, were you just getting doors closed? I mean,
so the first time I applied the waiver, because my son is dual diagnosis, they denied it. They essentially said that my son's autism was caused by his schizophrenia. And the reality is 64% of individuals that are on the autism spectrum, they develop some sort of autism or schizophrenia. Unfortunately, my son was one of those individuals that fell through the cracks in the school system, and he was not diagnosed early on. He wasn't diagnosed until he was 15. Again, this is someone that didn't speak till the age of 5, but wasn't potty trained till almost 6 years old, delayed in every way possible. And I was a mom just kind of navigating this world blind. I'm like, there's, again, not a stop shop where you can go and say, hey, this is where you go where you get help for your kid. I trusted the school, and I was like thinking that they have my best interest and my son's best interest at heart. But I found out along the way, mostly since the schools are underfunded, they try not to diagnose these individuals, because if they diagnose, they have to provide these services. So often individuals like him, because they don't have early intervention, it leads on to some serious mental health issues. And for us, it started in middle school. So it was the worst thing any parent can ever experience. So again, every time I meet a parent and I see that they're drowning, I want to help them, because I know exactly what it feels like, and you're screaming into an empty room and you're trying to get anyone's attention to say, hey, help me, I need help for my son. Now take it, for my son, it was wrong placement. He was in an environment that he couldn't handle. Being in a school setting was just too much for him. Once we got him into the Eaton Academy, it has been life-saving. Like for us, we have no hospitalizations. He's doing amazing. He is a productive member of the community, and people now want to hire him because he is doing so well, but he needs those supports, and that's what the waiver gave us. One, as a parent, I'm not going to live forever, and I don't have the type of family that's going to step in and take care of him, you know, and also wouldn't want to burden anyone with him. So setting up and having the waiver and having that assistance allowed me to actually give 2 people jobs that weren't working. It also allowed me to go back to work. It allowed my son to go into the community and, again, blossom, which is what any and every parent wants to see. My son is not going to be a doctor. He's not going to be an attorney. I'm okay with that. I want him to find his little place in this earth so he can find his purpose. You know, his purpose might not be your purpose, and I'm okay with that. I just want him to be happy and meet his full potential. It's not what my other kids are. Again, I said I have 2 kids that have autism, 2 different levels of the spectrum, and one I have no worries about, but the other one I have serious worry, because again, he's 23 and he thinks like an 8 to a 10-year-old. Everyone is his friend, you know. If he has $10, you need $10, he's going to give you $10. You know, he will invite everyone over to my house. He's constantly offering all these strangers, my mom can help you. Here's her card, call her. So, yeah. So all of my business cards went missing because my son is just handing them out to everybody. He doesn't understand the whole, he just wants to help, you know. So what I try to tell everyone is I was given a gift. I see my son as an angel. I mean, this is the closest thing to an angel that I feel like I will ever get close to. And I feel not only do I need to protect him, I need to, you know, help set that path so he can be successful without me.
Chairman Mathiak.
Okay. Thank you, Chair Lady. Ty, right?
Yeah.
I am so impressed. Just over the last couple of days, I've dealt with other parents of other syndromes that I clearly see the angst for the families because it's your loved one, and you're gonna cut your right arm off for your loved one. That's just the way life is. I think that there's something more we can do. I don't know what it is. There's got to be something more.
Waivers, if you can fund more waivers.
But
really.
then you have to find the people, the employees to help you. Was that difficult? See, people behind you are saying yes.
It is. I had to get creative. And again, I'm direct support, so I hire my own staff. And again, I go to schools. I recruit, people going into college. I again, any and everyone that I hear, you need a job, you have a good set of skills, I think you'll be good to work for my son. Transportation, I recruited his teacher to help me drive him back and forth. So there's you just have to get creative with what
you
we
have gotten very creative. Thank you
Yes.
for just those two ideas that will help some of the people that I'm dealing with right now. Does he need 24, maybe not 24-hour care, but does he need somebody with him most of the time?
Yes.
Some of the time?
Most of the time, most of the time. Again, he knows not to go and turn on the stove. He's very afraid of the fire, but his biggest thing is if there is an emergency, he won't know what to do. All he would do is
Right.
panic and pace back and forth. So yes, he does need someone to be with him. Going shopping, he has money means nothing to him, so he would just walk up to the cashier, give her $10, and walk away without change. So he needs that
Right.
oversight and someone to
Right.
say, hey, Isaiah, this is what you do. Hey, Isaiah, that's not appropriate. Hey, Isaiah, you don't stand 2 inches away from someone's face when talking to them.
Spatial recognition.
Spatial
Oh, yes.
recognition. But again, I also get some really funny and beautiful stories at the same time.
Right.
Again, with the psych meds that he's in, he's managed to put on a lot of weight. So I got the caretaker to take him to the gym. 15 minutes into his workout, he stopped the treadmill and he's telling her, I wonder what my mom's cooking for dinner. That's his main goal in life is what's for dinner.
Right.
It's very simple, but at the same time beautiful because he is so innocent.
Right. I got it. Thank you for all that you've done. This will be a good conversation for this committee. I believe that Chairman Dempsey is very heartfelt for you
Yes.
as well. Thank you.
Thank you. Again, every waiver does make a difference for my family. It has been wonderful just to have Isaiah do something other than sitting at home, being in front of a computer or watching TV.
Representative Donahue.
Thank you. Ms. Robb, I would like to get your card with your cell phone and your emails before we leave, please.
Yep.
Thank you very much.
Absolutely. It might even be on the policy brief, on the white pager. No, of course. And please use us as a resource. We are more than happy to talk to y'all. Information support at any time.
Thank you, and we'll all be looking out for so many people that are going to fill the Capitol tomorrow, telling their own stories as well. So thank you so much for all that you do. Okay, appreciate it.
Thank you. Thank you all.
Next up will be the Department of Veterans Services, Commissioner Patricia Ross. Whenever you are ready, thank you.
Yes, ma'am. Thank you, Chairman Dempsey, and thank you for the other members of the committee for having me here today. I am very honored not only to be here, but to have my comrades in arms. Being a fellow veteran, I have a whole back row with folks that are supporting me in today's briefing. So I just wanted to thank the Atlanta Vietnam Veterans Business Association as well as some of my team for being here with me today. So we're going to talk about the amended FY25 budget and provide a brief update on the organization. And last year, you were so supportive of our fiscal needs, and those ended up getting approved through House Appropriations, Senate Appropriations, but then did not make the final budget. So you will see I will have a couple of asks this year. Looking at the budget, which maybe I'm going the wrong way. Well, that will be a very quick brief if this is the only budget slide I have. Or I can stand over there. It's probably better if I do it. You sure, Mark? Okay. Okay. If you can go to the second slide. So that's way, there we go. And can you put it in presentation mode so they can see that, please? Amber to the rescue. Okay, real quick. If you look at the House tracker, we're actually on page 7. Specifically, we are line item 48. So those are our 4 programs. So looking at departmental administration real quick, no changes there with the governor's amended budget, no changes for the Veterans Memorial Cemeteries, of which we have 2. We did have a change with the Georgia War Veterans Nursing Home. That $250,000 was for nurse retention. Originally, it was for a nurse retention grant for our subacute therapy unit, which we've not opened yet. We asked last year to have that for the entire campus, and it was supposed to be a matching state portion to a federal grant. But because we thought it was for the subacute therapy unit only, it was only last week that we got clarification from the Senate Appropriations team that we did get our approval to have that used for the entire campus. And so we'll talk about that $250,000 in a minute. Also in 48.4 veterans benefits, that's actually a matching portion, a state portion for our UNITA system, our closed loop referral and case management system that we use statewide. That will be combined with what the governor approved in ARPA funds. We do have some residual funds left over to be able to fund us for another year. There we go. I think it's working for me now. Okay, so we're first asking to retain the $250,000. Now that we know that it can be used for nurse retention at our Milledgeville campus, let me give you some staggering numbers. So when we looked at our attrition rate in our nurse population, just during the last year, it was 49% for registered nurses. 50% for licensed professional nurses. So 50% turnover in our LPNs And what truly hit me was for our CNAs, which are the lifeblood of what we do at a war veterans home, 88.6% turnover. Many of them aren't even making it through orientation. And so what that means is every time we have somebody not there to take the next shift, we have to hold folks over because, of course, we cannot leave our patients unattended. And so that meant over the last year $1.2 million in overtime cost just for nursing there at our home in Milledgeville. So staggering because they have to staff multiple continuous shifts, and of course that does impact retention and impact those attrition rates. So last year you did approve a consumer price index for our homes, but again, it was not in the final budget. So since that time last year, as well as every year the federal government again gives us a CPI increase, which is their matching portion to what the state has. Between last year and this year, we've increased 10.6%. So what that equates to is about $1.5 million. Just in the year since I've seen you, costs have gone up, and the federal government would have matched us the $1.5 million. So what we're asking for is $1.5 million, and that's just to maintain our current bed count because we've not received increases in our state appropriations for our homes in over a decade. And so I'll show you on the next slide kind of what that looks like, but I'll go into this in more detail. And then also you were very supportive of our subacute therapy unit. I wish Commissioner Tanner was still here. We've had some great conversations about it. It is a complementary mission to what he does just for our veteran population. But I'm going to go into more details. And so let's jump into the war veterans homes because that is our number one priority for the amended budget. Ultimately, what we're seeing is the demand for veteran skilled nursing care is increasing while our bed count is decreasing. The best way to see this is if you look at this chart, what you see is with the lack of state funding. So if you look at FY14, you can see the federal government was giving us a matching $98. And what has to happen with our funding model is for our beds, the state has to pay at least 50%. What that means is at least 50% or whatever the delta is with the cost of care if that's more than 50%. So back in 2014, the federal government was giving us $98 per patient per day. We had 250 patients. So fast forward to now, we are getting $144 from the federal government, but if the state appropriations don't increase at the same rate as our federal appropriations, we cannot get that money. We cannot be reimbursed by the federal government, and so we have to reduce beds. What that means is right now we're at 54% occupancy, and we're required by the VA to be at 90% occupancy. We're not even close. So our only recourse, again, is to reduce our beds. And if we were fully funded for the 486 patients across both our Milledgeville and our Augusta homes, that would equate to about $8.3 million we would have received in matching federal funds. That's just money right now we're leaving on the table and patients we're not able to take care of. So this slide has a lot of really small writing, but you do have the slides in front of you. So while we're only asking for that 10% increase, which is just over the last year to keep the number of patients we have the same, you have to know that healthcare costs have increased 63% in the last decade. And while our state funding, which again must be at least 50% or more than the federal match, has stayed flat, in fact, it's actually dropped. The only reason we've gotten state increases is because our Augusta home is run by Augusta University. They've gotten salary increases as well as some TRS increases. That is the only reason we've gotten increases at all. And what's happened is our Milledgeville home has suffered more. So this is all based on the consumer price index, so that if we don't increase our funding at the same rate, that CPI, of which all your nursing facilities use that increase as their benchmark each year to, again, get federal funding. Just in 10 years alone, we've lost 114 beds. That's almost my entire population at my Augusta home, which right now sits at 121. So that's basically one of our homes. Those patients' beds is what we've lost in just a year. If we stay on this trajectory within the next 5 years, we'll be at 100 beds. And again, we can right now take 486 patients. Both homes actually have a waiting list, and we are not marketing our homes because we don't have the state funding to bring people in right now, but we have about 28 people that are on the waiting list that quite honestly are just waiting for folks to pass away to then come into our homes. And that's the situation we find ours in. So all these numbers don't necessarily even reflect that for nursing home care for veterans, that is primarily a state function. Most folks think, oh, well, that should fall under the VA. No, the VA funds health care. They don't necessarily fund skilled nursing care. They fund a portion of it through federal appropriations and a grant match. And so that's a misconception. The VA actually has told us we're close to 1,500 beds short here in the state of Georgia. We should have 1,975 beds in Georgia. Again, I am only meeting 13% of what we should meet as a state. So what does this look like if we compare ourselves to other states? And you can see the map in front of you. So this reduction has not only resulted in us not caring for the total number of veterans that we should be caring for in both facilities, but we're significantly behind every other state around us. While we only lag Florida in the number of veterans that we have, so we are about on the same, we have about the same number as North Carolina. We're actually 7th in the nation, they're 8th. If you look at South Carolina, and the reason I highlight them is they are opening their 6th home next month. They have half our veteran population, and the state has just put up the 35% match, which is about $35 million for 3 new homes for the state of South Carolina. So within 2 years, they will be at 9 homes, again, with half our population. And then to simply stop the reduction in beds in our homes and not grow patients, we need that $1.5 million in the amended budget just to keep status quo. It costs about $50,000 per patient a year to be able to add a bed. But we also need the $1 million, which is a one-time cost for the subacute therapy unit, or if Commissioner Tanner was here, he would call it a med psych facility, and I'm going to go into more detail about that. With that one-time funding, we believe we could open that facility in about 6 months. And I did give you a one-page sheet for you to take back that gives you all the information. But if we could talk about the subacute funding, the state has done a tremendous job, and y'all have done a tremendous job to make mental health a priority for Georgians. It's a priority for not only you, for our governor, and everybody. And you did support opening this facility last year, but again, it did not make it in the final budget. So I'm pleading with you to let us open this completed facility. We believe that we can operationally fund it with that $1 million, which will cover about a year to bring on the appropriate staff to again provide mental and behavioral health services for our veteran population. And and I'm sure you were in the joint session this morning, you heard about the need for mental and behavioral health and accountability courts. You've also heard about it with the DBHD debrief. Other agencies are getting funding for like nursing homes. We just aren't, and we need to be able to attend to those mental and behavioral issues that are unfortunately a large part of our veteran population that have been at war for decades. And so we need to have a facility that is open to individuals and veterans that have traumatic brain injuries, suffer from post-traumatic stress, missing limbs. And we do have great programs and therapies with big efficacy in the programs that we know can make a huge difference in these veterans' lives. But the bottom line is research will tell you that the invisible and the visible wounds of war will destroy families, as you've already heard, force our veterans to live on on the streets, end up incarcerated or in jail, or they'll die, specifically by committing suicide. It should also be noted that the state has already invested $6 million in renovating and building this facility. The federal government has put in $11 million. And what happens if we cannot open this facility is we will owe the VA $11 million back. So we will have to return that money. That is part of the memorandum of agreement we signed when we embarked upon this construction. So in addition, the need for mental and behavioral health is growing both in our older veterans. We currently have about 25 on behavioral health watch in our homes. And you have to understand that once we admit folks into our homes, they don't leave. We can't find other facilities for them to go to. Nobody will take them. And so we put them on a 24/7 watch. But we also have younger veterans who still need this care. We have a 43-year-old who suffers from post-traumatic stress, severely so that he is basically catatonic. But we know that by opening this unit and bringing in these mental and behavioral health providers and providing this therapy, we believe we can reintegrate him and others like him back into society. And at the very least, those individuals that may not be ready to go back home or into their communities and families, we will have a safe place and they will be able to make marked gains in the activities of daily living, and as well be able to lessen some of the symptoms. Because again, post-traumatic stress, while you may not be able to cure it, you can certainly lessen the symptoms and make it less acute. And that's really what we want to do with this facility and why you gave us the money to construct it and renovate it in the first place. And it should note, because I know this has come up, these are all Georgia residents. It's part of our Milledgeville home, which requires at least you be a resident of Georgia for the prior 2 years or 5 years within the last 15, and that's in statute. So I wish Representative Oliver was still here. Of course, within the last 24 hours, this slide makes me a little nervous. You can see our federal and state funding kind of model where we're receiving about 60% of our funds from the federal government. And we've put calls out to our grant managers to see how the most recent pause will impact us. But let me break down just where we receive federal funding so you can understand. So we receive plot allowance to bury all of our qualified veterans at our cemeteries, but we do not receive any funding for their spouses or qualified dependent children. Again, because of the reduction of state funds, we've passed some of the cost of care to our patients. So our patients in the homes have patient fees, which as of the 1st of February goes up again, as it has every year in the last decade, to $31.05 a day. Our education and training program, also known as the State Approving Agency, is a fully reimbursed program from the VA, and I will talk about them in a little bit. All other federal funds are actually through grants we pursued over the last couple of years, but they also are temporary in nature. Those grants and programs will be covered in future slides, but include expansions for our veteran cemeteries, our suicide prevention efforts, again trying to get in front of that problem instead of being reactive to a veteran suicide, as well as our Unite Us referral platform. Ranging anywhere from 1 to 3 years, this temporary grant funding accounts for about 35% of our overall federal funds, or about $15 million. So it's significant. I know many of you were at some of these ceremonies, so I had to throw up a slide to talk about the demographics of our state. And I think this is a pretty misunderstood population, and only because we look at the VA's numbers. So the VA will tell us we're about 670,000 veterans in the state of Georgia, but they will also tell you that number is not accurate. Those are only the individuals that are engaging or have signed up for VA services, are getting VA health care, getting VA benefits, or have signed up for using their GI Bill and getting education. They have told me specifically from the VA central office it's about 60% accurate. So if you do the math, And that's almost 1.1 million Georgians are veterans, not the lower number that the VA gives us. When you add the active duty, reserve personnel, our guardsmen, the DoD personnel that are actually serving on our military installations, you have 12.7 of Georgians are military affiliated or employed by the military. So that actually is a large constituent base and a huge economic driver for Georgia. As 63% of those veterans are of working age. So think about the economic impact these veterans are having on our state. And I also have to brag, so I have a tremendous team. We've done a lot of internal efficiencies. We've maximized the funding we have. We are a small agency. We did centralize accounting services and are getting those through the state accounting office, and they have been fantastic and tremendous partners. 2 years ago, you approved us digitizing DD-214s, or your military separation documents. So if somebody had opted for the state of Georgia to get a copy, we now can get that document within minutes instead of the hours, if not weeks, it would take for us to go through physical file cabinets to try and find us. So that's been a huge benefit for our veterans as well as our field offices. We've also saved about $12,000, which is a lot of money for us. I realize following some of these other agencies, it doesn't sound like a lot, but we've done that through eliminating fax lines that we no longer needed. We've also worked with state properties and specifically the Technical College System of Georgia and other state partners to co-locate our offices at a lower cost where we could get rid of higher cost leases. And I won't go into Unite Us right now as I have more detailed slides at the end, but this program has been a huge resource, not just for veterans, but all Georgians, and I will talk about that. As far as the impact, the savings, we invested in a long-needed domain change in working with the Georgia Technology Authority. Because we were not a .gov site, we had a really long URL. It's horrendous. Our emails bounced back from pretty much everywhere, to include within state government, but also to the VA, which made it impossible to do our job. And so we made that change, and now we're a ga.gov site and eliminated that problem. We were also able to take some of these savings and turn a low-paid administrative position to create a transition and employment coordinator who focuses on our transitioning military, which is a large population here in the state of Georgia and one that needs assistance as they go through that transition process, but also those transitioning from our correctional facilities, those that were incarcerated. So research shows that if our veterans don't transition successfully in that first year, that they're more likely to be at risk for homelessness, suicide, substance use, justice involvement. So we decided to put a real emphasis on that with some of the savings we were able to garner through internal efficiencies. And then through grant funding, we've expanded our suicide prevention efforts, and we've worked with partners across the state, and I'll go through that as well. So I had to do this because most people think we're a large organization. We're 152 personnel, the majority of which are in our 55 field offices. So our face-to-face contact. We're also a state agency that works in the office 5 days a week. We work standard business hours. We're not a teleworking agency. So these 152 people do a lot. And many of them, if you look at the slide, we wear multiple hats. I have my chief development officer and my chief financial officer and my grant manager sitting right there, that one individual, Mr. Mark Demers. So you can see that we take advantage of the skill sets we have on our team, and they are amazing. We do have statewide reach, and I have to talk about how we're actually expanding our presence within our existing footprint. You did give us funding last year for 2 new positions in Houston County for the Perry Clinic. That actually, they start 1 March. That clinic has had some delays in opening. It actually opens to veterans on the 3rd of March. So they're going to be in place to see those veterans. And then to better catch that transitioning military veteran population, which is crucial to help them transition and successfully navigate civilian life, we had offices on Fort Moore and Fort Stewart, but by the end of this quarter, we'll expand to Fort Eisenhower as well as Kings Bay Naval Submarine Base. And then to reduce rental cost, we are actually going to Atlanta Tech, moving an office there. And we're moving our office in Albany from a leased space to Albany Tech. So we're excited to partner with them. We're also looking to find space in Gwinnett. So we're in talks with Kennesaw State University and Gwinnett Tech, Kennesaw for Cobb, Gwinnett Tech, and then the Vet Center in Gwinnett County. Because we do know that's a population we don't have enough veteran service officers at. We did close 2 offices in full transparency. Our Bainbridge office was a part-time office, was only staffed 2 days a week, and had a very low throughput. Unfortunately, we've not been able to find another lease space that we could afford. We're still working with state properties to try and get an office down in Southwest Georgia. We also closed our office in Lyons. And we are also working with state properties to hopefully find an office in the Vidalia area, but we did move that position to Statesboro to still take care of those veterans. But by the end of first quarter, we'll be up to 60 offices across the state. And again, you approved 2 new positions. That's one of those offices. And then we've internally realigned positions to better meet the needs of our veterans where they're at. I know in talking about legislative intent, you may say, why in the world did you create a transition and employment coordinator? And I'll tell you why. We wanted to really hone in on some of the things that statutorily we are required to do, one of which was you giving us a homeless coordinator last year. So through her, we've expanded housing services connected to facilities across the state. Again, through departmental efficiencies, we've created that transition and employment coordinator. So we've bolstered and expanded great working relationships with GVRA, the Technical College, to include their Office of Workforce Development and their folks, which is the Jobs for Veterans state grant folks. They're individuals who help veterans with significant barriers to employment. So moving to our next program is our cemeteries. So the big news here is we did get federal grants to expand both cemeteries. So over $8 million between our Milledgeville and our Glenville cemeteries. And based on the current rates and how many spaces we're able to add both pre-placed crypts, in-ground burial spaces, as well as in our columbarium, we believe both of those cemeteries will last us, that space will last us the next 10 years. So that is great news, getting those federal funds. I'll now jump to our Veterans Benefits, that program. If you recall on our organizational slide, you know, the majority of our people actually sit in Veterans Benefits. And with the landmark legislation back in 2022, which was the PACT Act, we have historically been 4th in the nation. Again, we're 7th for the number of veterans, but we're 4th in the nation for filing claims and getting benefits for Georgians. This is behind the big 3, which is Texas, California, and Florida. I don't think we'll ever meet their numbers. But if the demographic slide didn't truly convey this, I think we are punching way above our weight class and filing more claims and getting more money into Georgians' pockets and thus into Georgia's economy. So how do we do this? We did this through outreach. So in partnership with other organizations, we are meeting veterans where they are. We did 56 outreach events, 4 huge events where we saw thousands of veterans in Cobb County, Gwinnett County, in Rome, and in Augusta. We assisted 806 veterans, filed 438 claims on site. We brought in VA Central Office, who actually did medical exams on site or doing ratings on site. We had a Vietnam veteran receive his 100% disability rating at one of these events and walked away with a retroactive payment in 6 figures. So life-changing. But we've really worked to bolster these events and again, trying to do these across the state. I know back in 22, you approved a suicide prevention coordinator. That has been big business for us. We are doing so much, and primarily with funding from federal grants. So just within the last year, we've connected to 12,000 military veterans or their family members. Through our suicide screeners, we identified 73 individuals at higher moderate risk for suicide and connected them to clinical care right away, either through the VA or a community partner. Based on those who took the screeners, the suicide prevention team has reached almost 1,000 veterans this past year. We annually conduct a summit in coordination with Kennesaw State University and DBHDD to bring not only veterans but community partners, clinicians, counselors, educators to learn how to identify the signs and prevent suicide. This last year we had 65 counties represented. Additionally, working cross-agency, brand new to us, we have a suicide mortality review grant. So working with Kennesaw State, the Department of Public Health, DBHDD, and medical examiners and coroners, we are now looking at the root cause behind veteran suicide to then prevent future suicides. And I do have to point out before I segue into our homelessness prevention, I did want to add that being homeless at any point in your life or being at the risk of homeless has the greatest impact on your mental health and is the largest contributor to suicidal ideations. So there is a direct correlation. So if you look at our homeless coordinator, who we hired as soon as you approved her, so 1 July of last year, we have directly assisted 30 veterans in getting sheltered, found stable housing for 5 families, working with organizations who have grant funds. We referred another 15 veterans. We've done 8 homeless stand-downs across the state and working with housing authorities to make those connections. She actually has a 33-page document of every homeless shelter in the state. And what I've done is on the success stories that you can read at your leisure, showcase some just real world examples across the state of Georgia where she has made an impact and the team has made an impact on individuals that were homeless. When you look at our transition and employment coordinator, again, that new position that we created internally, she's been out and about to various organizations and trying to connect to younger veterans, which is a population we don't usually see. She's done that through coordinating with our colleges and university systems. She's provided personalized support, helped 8 veterans to date actually get jobs, is working with the Office of Workforce Development and our technical college system. And then through the collaboration with the Department of Community Supervision, actually got somebody who had just left prison a job, a meaningful job where he is able to be self-sufficient. And I know not to get ahead of myself, I'll talk about financial insecurity as a big need in our veteran population, but knowing this, she coordinated with the PBS team to help a veteran make smart financial decisions as they pursue employment. I know I was specifically asked to talk the mental and behavioral health grant, so I hope you've picked up on the theme about some of the serious issues impacting our veterans. But 2 years ago, you in the General Assembly and our governor provided funding for a veteran mental health grant. It originally was $750,000. This last year, you increased it to $1 million. And I wanted to personally thank you all for the difference you are making in veterans and their families' lives. Currently, our 2 grantees, these are their statistics, they give us quarterly reports, are the Cohen Veteran Clinic in Hinesville and then the Emory Healthcare Veterans Program here in Atlanta. Both are having huge success with the grant funding. The Cohen Clinic has served over 200 new patients and provided over 1,800 services. This is not just in person in Hinesville, they do telehealth across the state. The Emory Healthcare Veterans Program that provides intensive outpatient services to our post-9/11 veterans has helped 179 veterans and active duty members reduce their mental and behavioral health symptoms. So that is money well spent. So I wanted to thank you for that. Real quick, I mentioned our state approving agency. Again, they are fully funded by the VA, but here's what they do. They approve all organizations that receive VA education benefits, whether it's schools, employers for on-the-job training, or apprenticeships. We're also 5th in the nation. Again, keep thinking we're 7th for our veteran population, but 5th in the nation in bringing in education funding to the state. And we've accounted for $27.6 million in VA educational benefits, such as the GI Bill and our technical college and university system schools. So that's direct into our public institutions. So our overall impact, we are serving more veterans, their spouses, their caretakers, where they are, all while realigning offices to meet the larger veteran populations in the state. And just to give you that bottom line, our team has brought in about $23 million in retroactive payments alone from the VA, with not just that one veteran I mentioned, but several receiving 6 figures and back payments from the VA. So the big total I have to give you, this is the impact on Georgia. So your Georgia Department of Veteran Services directly, it brought in almost $5.2 billion into veterans' pockets, into Georgia's economy, and that's up from $4.4 billion last year. So a significant economic impact to the state and for those veterans who so desperately need those disability compensation, pension, and then educational benefits. So real quick, and I know this is the very end of my presentation, I'd like to talk about Unite Us, because we did get funding in the amended budget, again, to match with what the governor had approved, and ARPA funding that we had some residual funds, which will allow us to have this system for another year. So it's more than just Georgia Department of Veteran Service using this system. It's actually, we've partnered with the Technical College System, their Office of Workforce Development, the Vector Centers. Pretty much not just if you're a veteran, if you are a Georgian, you can use this system, and you can use it in a variety of ways. So since going live in January of 2022, we've helped over 15,000 individuals with 16,000 social needs, be it veterans benefits, employment, education, financial assistance, and pretty much anything else on that social needs spectrum. The exciting part about having this system is we've onboarded well over 600 partners across the state. And over 90% of our referrals are accepted by those community partners. And this last quarter alone, we had a 97% resolution rate. So we put in a referral, somebody accepted it, and they were able to help that veteran, that family member, that student, which is incredible, which means Georgians are getting the assistance they need when they need it. If you look at our monthly volume, you can see the first quarter of the calendar year historically has seen our greatest need, specifically veterans income support, which also includes veterans benefits, education, and then you can see where housing and shelter or assistance with rent or mortgage to prevent homelessness are the top needs across Georgia. So just quickly, this last slide shows you that a 99% of referred cases are accepted within 4 or fewer days, with the majority being accepted in just over 1 day. So that's 1 day from a referral for a need being put out there to it being accepted, which is incredible if you think about how we used to do this, which is spend weeks calling our phone tree trying to find somebody that could help a veteran or a family member in need, and now we're doing it in just over a day. So this system has definitely made not just huge impacts to our veteran population, but again, to Georgians. We have a public resource directory on our website that anybody can go to and find all of the resources near them and whether they qualify. We also have the ability for them to submit their information and get connected to resources in their area. And then this last slide, I know they're supposed to come in February. Augusta Cemetery, I get questions, just so you know where they stand. They are actually looking to do a SPLOS to fund the Augusta Cemetery. The VA will never have it high enough on their priority list because of the 75-mile catchment area that's covered by Fort Jackson and our Milledgeville Cemetery. But Augusta, which has been trying to get the cemetery since 1999, is determined. So you'll see the folks from the CSRA come up here, and I know that they've told me that they're looking for about $1 million in state funding for kind of the entry road and landscaping, and then expect to have $13 million for the rest of the project. This will become a Georgia State Veterans Cemetery once the city of Augusta turns it over to us, and we expect it might rival the number of interments we have in Milledgeville. So we anticipate about the same size staff, just so you know. That'll be ongoing operational funding for personnel cost, and then probably 1 year of funds until we start bringing in that plot allowance. So I did just want to put that out there because I know I always get questions on the Augusta Cemetery. But with that, I wanted to open it up for the questions that you have.
Is Emery first?
Thank you for what you've done. First, I want to thank each one of you for your service and for being here. Wish we had let you go first and you wouldn't have had to sit through, because you see a lot about this committee. We have serious, problems. And when I say that, I do appreciate what you've done, because this has been a struggle with me being here watching the commissioners before. Some were up, some were down, and you guys suffered. I would like to ask a couple questions, and with that, in my previous life, I was able to fish and travel and do it pretty seriously, and I fished Florida quite a bit. With that process, everyone I fished with in Florida loved the way it was ran in Florida, the veterans, and were treated. And it's terrible that our administration in the last several years will allow illegals to come here and put all the money behind them, and then they don't take care of you guys. And they don't take care of the things we need to do. I apologize for that. And really, I want to commend you for it, because, I've watched this process for the years I've been here, and I take it serious. And everybody here does. But again, I just want to say thank you. The cemetery, state property, I carry most of the legislation with Chairman Green. Yes, and with that, as vice chairman, I take it serious, and I have people that reach out and talk about the cemeteries, and we need to be taking care of these. And the splash is a great idea. I believe people will always give more money. If you charge them a penny or whatever, you can raise that money to accomplish whatever, but we should have more money put in the budget for this over some of the things that we put in the budget. And that's just my opinion, but I want to make sure I made that knowledgeable.
Well, thank you so much for that, sir. I appreciate it.
Yes.
Representative Cameron?
Thank you. Thank you, Commissioner, for your testimony. Thank you for bringing the heroes with you today to support you. I've got a lady in my district. She's a Desert Storm veteran, and she works with homeless veterans just organically out of the back of her truck. How would she get a hold of your person?
She can call our main number, or I can make sure you get her name. Her name is JT Thompson.
What?
But JT Thompson is her name. She's our new homeless coordinator.
Okay.
Would love to, we're trying to create partnerships wherever we can, because we do realize a lot of the homelessness prevention and support happens in communities.
Yep. Thank you.
Thank you, sir.
Representative Anderson?
Thank you, Madam Chair. Commissioner, thank you for the presentation. And if I recall, in part of your discussion early on, you were talking about the creation of the Transition Employment Coordinator position.
Yes, sir.
And you mentioned also that in addition to working with people transitioning from their military career to life in civilian situations and that sort of thing, they were also working with the jail system and that sort of thing too. Is that being done? Is there some coordination with GDC, the Department of Corrections, with that? I know they're going through a lot of changes, but they have a very robust transitional plan going forward too.
Yes, sir. We're working with them. We had, of course, before the current situation, have had quite a few discussions. We've actually gone into the prisons and met with our veterans, especially those who are getting close to being released and are going to those transitional units. But you'll find that, an incarcerated veteran, sometimes it's difficult to find employment. And we do have folks within the Office of Workforce Development that do the federal bonding program. We have entrepreneurship. Tends to be a big area where a lot of our incarcerated veterans want to go. And quite honestly, it kind of goes back to why we need the subacute therapy unit. And if you listen to Chief Justice Boggs this morning, a lot of these folks, if they had had that mental and behavioral health care, probably would not be in our prison system.
Well, good. Thank you. Thank you for
Thank you,
creating
sir.
this position and working with them. That's a
Yes,
critical
sir.
part. Thank you.
Thank you, gentlemen. Representative Glaze?
Well, first of all, I want to say thank you so much for your service, for our chairman, and your service for those who sit behind her as veterans. I am a veteran wife. My husband's Army disabled, and so you have my sincere love and support as I sit here. I wanted to ask again if we could point out the amount of money from the PACT Act that this report shows that came into Georgia.
So overall, we can't break out necessarily the PACT Act demographics when we get them from the VA. Will show the number of claims submitted. It doesn't show us how much money was returned to us. But just overall, and you have to understand, a lot of the new business we've gotten in the last 2 years has been because of the PACT Act, whether they were truly PACT Act claims or individuals that now realized there was a Georgia Department of Veterans Service and they needed to apply for their disability benefits. That's $5.2 billion into the state.
$5.2 billion. And that inordinately went directly into the economic viability of the state of Georgia.
Yes,
Would we
ma'am.
not
It
say?
went into our veterans' pockets, and I will tell you, it then goes to Georgia because that's where they're spending their money.
And $27.6 million into education
Yes,
for
ma'am.
veterans and
And the
hopefully-
university system and the
university
technical college
system.
system.
The numbers are staggering, with great expectations that we want to do even the more. But this unite us. I just want to commend you partnering with 600 and members, and so that your rate of response is in the 90 percentile. This is such a wonderful program. I just want to make sure that you know from where I sit, I'm new, but it is my honor, my pleasure to sit with this great group of legislators to do more for veterans throughout this state.
Well, thank you, ma'am, for that, and I appreciate your husband's service as well as yours. I'm a military family member, military spouse, military kid, 25 years myself, so I kind of check all the blocks and know that it is not an easy life, but it is one I think we all cherish. But our veterans do have needs and substantial needs as it comes to our war veterans' homes. So thank you for considering that.
Commissioner?
Yes, ma'am.
Wow, you have come a long way, and I am so proud. I am so
Thank
proud.
you.
You know, I'm from Spalding County,
Yes,
and we
ma'am.
just purchased a church that is going to house our homeless veterans so that they will have an address, even if they're still on the street, because
That's
some of them are
huge.
not going to stay in that church. But they will have an address. So guess what they will get?
A driver's license. They get a
And
state ID.
all their benefits.
All their benefits. It's
And
huge.
I want to give a shout out to somebody who's near and dear to my heart. Sergeant Major Brownlee is coming back
Yes.
to Griffin to help us. And I just am so thrilled.
Yeah,
that
I've known Sandra for quite a while.
I've known her a few years, and when I found out she was coming back home, I think it's coming back home. But I'm very thrilled to have her back, and I want to invite all of you when we get that opened. I want you all to come and see it.
Absolutely.
I'm excited for it.
That's
Gentlemen,
tremendous. Thank you for sharing.
Thank you. Thank you. Thank you. Do you have something else?
No, Sandra Brownlee was the person who helped my husband.
Oh, wow.
So it's just
See?
unbelievable. Just
She's a-
yes, she is.
She's
working
incredible.
way below.
She really is. She really is. Anyways, gentlemen, I would invite you to come too, and we have watched this commissioner bloom over the last few years, and I'm so proud. You
Thank you
had
for that.
great mountains to climb, and you've done very well, my friend. Thank you. Good.
I have a great team. I really do.
Thank you. Thank you, thank you.
Thank you
Do
so
we
much.
have anything else? We've got a few public comments, but thank you for being so patient, you guys. We sure appreciate you being here. Call us anytime. That's what we're here for, too. Great. Okay. Tyler Mann and Camilla Miller from DeKalb, you guys are first. Is that correct?
Thanks, sir. Thank you.
Good afternoon. Thank you very much. I know it's been a long afternoon. I will be as brief as I can. My name is Tyler Mann. I'm the Director of Policy and Legislative Affairs in the DeKalb District Attorney's Office. I had with me Camila Miller, who is our UIFSA Director. She unfortunately just had to leave 5 minutes ago for a family emergency. And also our District Attorney, Sherry Boston, had planned to be here today. Unfortunately, it's also budget season in DeKalb County, and she was required before the Board of Commissioners, which is not to say the board is more important than this committee. It was just that no one could fill in for her there. So you have me, and I will do the best I can to provide the information that we'd like to give you. We're here to ask for a supplemental budget for our UIFSA operations. UIFSA is UIFSA. It stands for the Uniform Interstate Family Support Act. It's a federal mechanism by which child support is established, enforced, and collected when the parents live in different states or countries. A very important thing to note, you have not seen us here before. This is not a DeKalb County program. The state is obligated under the Child Support Performance and Incentive Act of 1998 to provide these services. Failing to provide the services, which are based on a contract between the state government and the federal government, will result in a penalty period, a reduction in funding, and ultimately an obligation of the state to repay grant funds that were given in support of UIFSA operations. This is not a DeKalb County program. In the past, DHS has handled budget requests because the state obligation is funded through DHS. And it's only in the last 2 years that our office has been required to seek supplemental funding on its own. This is a time-consuming and resource-draining process, and though our primary ask is a supplementary budget for this fiscal year, our strong preference is that as the big budget approaches, this request go back to DHS as part of the DHS budget. Again, this is a state program, a state obligation that DeKalb County opened an office to support at the request of the state in the 90s. For 25 years, we've been performing this work, and we act only on behalf of the state. We are in a position now where funding was cut, as much funding was cut during COVID. We are still at that level. Based on the federal guidelines under the statutes that I named, we should have 23 staff members to initiate cases on behalf of DeKalb citizens who are seeking support from parents in other jurisdictions, and to collect from DeKalb citizens who owe money to parents in other jurisdictions under this obligation under federal law. As I said, the number we should have is 23. We have 19 people in our office. It's a separate division within our office. And this supplement is just to maintain those 19 staff members. All of this money would be used for personnel, just salary and benefits. And the total dollar amount request is $563,023 for the remainder of this fiscal year. Without that extra money, we are in a crisis. We have, in the past few years, managed to scrape by. We went to DHS in 1 year, and they were able to find additional money. We went to our county commission, which is not the way this funding is supposed to work, but the county commission, realizing that the alternative was not to have these services, made us whole 1 year. And 1 year we actually reached into our own office budget, which absolutely is not the way this funding is supposed to work, so that we can maintain operations. We are out of those options. And without this money, we will either have to lay off employees or terminate operations altogether, which will be a violation of the state's obligation under its contract with the federal government. I would like to point out that we understand that a laudable focus of the governor's office in this budget cycle is seeking ways to trim costs through technology. This is not an area where that is possible. The people who do this work are specialized. UFSO is complicated because the people in Georgia are interacting with other states, their laws and regulations, and other countries. Our turnover is extremely low. Most of the people working in our division have 10 to 20 years of experience working with UFSA, and the loss of their expertise would be a significant blow to the state's ability to provide these services. The options, if we lay off people or fold our operations, are for DHS to take this on themselves, which we understand they are definitely not prepared to do, or for the state to not provide these services, which again would be a violation of the federal agreement. There are 3 jurisdictions in the state that do their own UFSA operations. DeKalb is one of them, Cobb, and Clayton County. The rest is handled by the state. And again, we started our division at the request of the state in the 90s because of the large number of cases that we handle in DeKalb. To put it bluntly one more time, we're not here asking for help for DeKalb County. We're here because we don't have sufficient funding to do our part to help the state fulfill its federal obligation. I should point out one important thing. I am not an expert on the contract between the federal government and the state government. But though our request is approximately $563,000, my understanding is that the agreement between the state and the federal government is that the federal government will eventually cover 66% of that cost. The way that it would have to work is that DHS, there would be an additional funding through DHS to us for the total of $563,000. DHS would then seek reimbursement for the federal government's obligation of the 66% from the federal government, which would leave the approximate total from the state's burden at approximately $187,000. But to be very clear, an allotment of that money will not accomplish what needs to be accomplished. The allotment would have to be the total amount, and then it would be DHS's responsibility to get reimbursement from the federal government for their 67%. I know it's been a long day. I'm just very quickly going to run through the packet that I've given to you and cover the stuff that I haven't already covered. The DeKalb office manages around 4,500 active cases. In fiscal year 2024, we distributed approximately $9 million in child support to families in Georgia. We support more than 6,000 children, including those who are minors or who have emancipated. And again, we have 4 vacant positions relative to what the federal guidelines say we should have. And we are doing our best to get the job done with that understaffing. But without this money, we will have to cut significantly more. As I said, the ask is $563,023 on top of the mandated budget from fiscal year 2025 of about $1.95 million. If you'll turn just quickly to the pie graph in the packet that I gave to you, which is on the 5th page, you'll see the breakdown of our expenses. And again, all of the request here today and most of our budget in general is salary and benefits. These are just people who are working hard recovering this money for families in need in Georgia. The next slide with the line graph shows the red line is our number of employees. You'll see in 2020, during the pandemic, we dropped down to the right side of the graph. Those numbers are the number of employees. And our total number is 19. This is case managers and admin. There are some other employees that are not included here. But you'll see that in 2020, we dropped down to 13 employees, and you'll see that collections dropped. The personnel jumped to 16 in 2022, and that has now come back down to COVID levels. But the green line indicates that our collections have leapt. And we would like to continue that work, but we can't without this additional funding and the additional personnel. Without this additional funding, we run out of funds in March, with no way that we can see to continue operations. We will either lay off staff or shut down operations, and again, the state will violate its contract with the federal government. We anticipate that a closure of our operations will create a 3-year backlog in the state's ability to collect in DeKalb County these child support funds for the families in need in DeKalb County. Those are the basics of what I have. I had intended to turn this over to Ms. Miller to give you quite a bit more information. I hope, Madam Chair, that perhaps after this meeting I might be able to schedule time with you and with my district attorney to discuss this further. But if you have any questions, I'm happy to answer them now.
Are there any questions? Not seeing any.
Okay.
We'll get that meeting scheduled.
Okay.
Thank you.
Thank you, Madam Chair. I appreciate it. Thank you for your time.
Next, we have Elizabeth Apley. Thank you so much.
Madam Chair,
Whenever you're ready.
members of the committee, thank you so much. Thank you for your patience. I'll try to be fairly brief. I'm here on behalf of House ATL, Enterprise Community Partners, the Corporation for Supportive Housing, Presbyterians for Better Georgia, and 9 to 5 Georgia, urging you to please consider increasing funding to the Georgia Housing Voucher Program, which houses homeless people with severe and persistent mental illness under the Olmstead Settlement Agreement. We have a serious problem with homelessness in Georgia, with an increase of 29% in the point-in-time count from 2018 to 2024, with a particularly high increase in unsheltered homelessness. As Commissioner Ross was leaving, and I thanked her for her remarks about veterans' homelessness, she said to me, 25% of our homeless are veterans. It's a very serious problem. People are dying from lack of shelter in Georgia at a time when we have an unobligated surplus of over $11 billion. This committee and this subcommittee has consistently taken the lead in addressing the financial need for this program, and I thank you for that. As you know, this is a state program that provides housing vouchers and supportive services for homeless people who are chronically homeless with severe and persistent mental illness, cycling through the criminal justice system, the hospitals, and the emergency rooms. And that is, in fact, the language in the settlement agreement that the state of Georgia entered into with the Department of Justice in 2010. We obligated ourselves to have the capacity to provide housing vouchers and supportive services to a target population that met that definition of 9,000 people. We're presently serving 2,200 people. This is an excellent program. It's cost effective. We know that the GHVP costs about $48 a day for the housing voucher and supports. Incarceration costs between $62 and $84 and going up all the time. Emergency homeless shelters and services cost $75 a day. And inpatient psychiatric beds in the hospital, obviously $770 to over $800 a day. And they've proven the effectiveness of this program to keep people stably housed. They looked at an analysis on another metric of what happened to this population's utilization of crisis services, and they compared the 6 months before the individual was housed to the 6 months after, and found over a 64% reduction in the use of those very expensive crisis services as a result of being housed. Demand for this program has grown sharply in recent years. The number of people entering into leases each month increased steadily from July of 22 to July of 23, more than doubling over that time period. And in the first 7 months of FY24, they saw a 23% increase in the number of people served. At the same time, costs have increased dramatically. The average monthly rent subsidy went up 74% from $652 in January of 2021, just before the pandemic, to $1,133 a month in September of 2024. There was also an average of about 20% increase in the subsidy cost in FY23 alone. So the program has not received an increase in funding, and they've been operating with sharp deficits, which I'm told were over $20 million in 2024. So as you recall, the budget for this program was cut by 24% at the outset of the pandemic, and this committee has generously recommended increases in a couple of years. We're still not back to that pre-pandemic level, though, and as you see, they're operating in the hole. Last session, the House recommended a $2.5 million increase. It didn't make it through the conference committee process. And so as a result of the failure to increase the funding, the Georgia Housing Voucher Program now functions as a waiting list. All people found eligible are referred to the Department of Community Affairs for eligibility for the federally funded Housing Choice Voucher, previously known as Section 8. And since April 1, when they stopped accepting people into the GHVP and referring people to the Housing Choice Vouchers, about 20 people have been leased up. So they're continuing to work on this. Their commitment was to convert somewhere between 500 and 700 people from the GHVP to the HCV, but not everyone is eligible for an HCV. It's very oversubscribed. You may recall last year when they opened up the waiting list for the Housing Choice Vouchers, expecting to address 1,500 people. They had in 2 days over 37,000 people signing up. And what they're doing is taking 1 out of every 2 of the federal Housing Choice Vouchers that become available through attrition to fill them with a GHVP eligible population. The additional problem is that the Department of Community Affairs that has entered into this agreement manages the balance of state continuum of care, not the continuum of cares where homelessness is most concentrated in the metro areas. We also know that the Housing Choice Voucher is more cumbersome and a slower process. So we're meeting some resistance with property owners, with landlords being willing to engage. So, you know that the Behavioral Health Reform and Innovation Commission has taken a position supporting this program, and their most recent report, just filed last month, recognized that a key part of addressing behavioral health in Georgia is ending the cyclical nature of behavioral health crises inherent in an inadequate COC infrastructure. They refer to an expert testifying that inadequate treatment for those struggling with behavioral health can often look like cycling through crisis, emergency departments, jails, and homelessness. That's specifically the population we're trying to serve with the GHVP. And what they said at page 23, quote, effectively mitigating individuals from re-entering the behavioral health care system, the court system, and homeless service systems in Georgia was identified as a priority by all of the subcommittees and advisory subcommittees. The commission recommends addressing barriers to accessing the Georgia Housing Voucher Program, expanding voucher availability through DBHDD. The homeless subcommittee obviously also went through the recitation of facts and supported the expansion of the GHVP. This echoes the recommendations of the Senate Study Committee on Unsheltered Homelessness in 2022, the recommendations of the Department of Behavioral Health and Developmental Disabilities Share Committee that's charged with oversight of supportive housing program that has recommended a $20 million increase in the amended budget and the big budget. And I would also mention ACCG has included in their 2024 legislative toolkit the challenges that counties face when they are faced with people with behavioral health and substance use disorder. They advocated for adequate funding to properly address the magnitude of the challenge, frequent contact of this population with criminal justice, homeless, and behavioral health systems, and urged actionable steps to find more supportive housing options. So the groups that support this include House ATL, Enterprise Community Partners, Georgia Advancing Communities Together, Presbyterians for Better Georgia, 9 to 5 Georgia, House ATL, the St. Vincent de Paul Society, the Georgia Budget and Policy Institute, the Corporation for Supportive Housing, the Atlanta Regional Collaborative for Health Improvement, Georgians for a Healthy Future, NAMI Georgia, the Georgia Mental Health Policy Partnership, that 95 organization collaborative, and others. So I know that there is much need and request for assistance to this committee, but this is an area where we can really make a difference for those people who are truly among the most vulnerable in our state. I'm happy to answer any questions.
Thank you. Thanks for the good factual information. That is really good for us to have. So, Representative Anderson.
Yes, Ms. Apley, thank you. It's good to see you today.
It's good to see you, sir.
A question, and it's simply because I'm curious and I don't know. Is there any overlap between the needs that you're identifying here and the now in comp waivers that go through DBHDD?
So there is some portion of the homeless population that has co-occurring mental illness and intellectual and developmental disabilities. But these people need something different than a waiver. They need supportive housing, which is going to provide them with wraparound services. You know from some of the other programs that you face that intensive outreach is necessary to connect with this population, to get them into housing, to get them the support they need to remain stably housed, to eventually connect them to health care and mental health care. So the now and comp waivers are not, I'm not aware of there being homelessness as a factor for, the whole point of the now and comp waiver is to avoid institutionalization, but I don't think that homelessness is the primary risk for that population. I'm sorry for the long answer. You surprised me.
Thank you.
Well.
Okay,
if we want to get out of this settlement agreement, we're going to have to fund the program that we know works and is the better taxpayer-saving dollar approach to this.
You know, that is actually fact. I know it well, and I've lived in that world. But
I know you've been
how we do
amazing.
it is very tricky. There is no doubt about that. But thank you for bringing the information to
And
us.
I'm
for that.
available. I'll be meeting with Amber and
Good.
happy to provide any support.
Good.
Thank you so
Appreciate
much.
it so much. Thank you. And next we have Skip Bell.
With your permission, we both signed up sort of at the same time, so if we can.
interrupt each other.
That would be wonderful. I like teamwork. That's good. Good to
Well, we're
see you.
veterans, we're used to
And thank
working
you.
as a team.
And thank you for your service.
Well, you're
Thank
quite
you.
welcome, and thank you, all of you, for allowing me to speak. My name is Skip Bell, and I am the chairman of the Atlanta Vietnam Veterans Business Association. And what we've had lots of statistics today, so I'm not going to give you any statistics. But what I do want to do is kind of speak from the heart about the veterans' homes, and it's a very personal subject for me because I'm 79 years old, and I might end up in one of those at some point, and I have many people that are my comrades that could be there if there was room for them to be there. As we get older, we all of a sudden the warranty wears out, on our bodies and things like that and minds. So this is a very personal subject for me. I also am very familiar with what's going on with the younger veterans. I'm a mentor in the Cobb Veterans Treatment System. So I have had very personal experience with some of these young kids. I did 2 tours of duty in Vietnam, and the units that I was with were tip of the spear units, which is to say we were out, either camping out in the jungle or, in my case, I was driving helicopters. So, and I had some issues when I got back. And when I talk to these kids that have made 5 or 6 trips, either to Iraq or Afghanistan or both, it's amazing to me that they've got any of their marbles at all, quite frankly, because combat's hard. I mean, it is hard. It's a hard life, even if nobody's shooting at you. You sleep on the ground. You eat cold food when you get food. So it's tough. I had a very good friend that I was with in Vietnam that killed himself when we got back. And this guy was a brave, good soldier. And, he for whatever reason, he just couldn't deal with what he had to deal with when he got back. So between the veterans' homes and this subacute facility that they're talking about, I hear this statistic of 22 veterans a day killing themselves. And this subacute facility might be able to save a life or 2. We don't know, but it certainly wouldn't hurt. So I'm asking that you consider these things. I know you've got, gosh, I wouldn't want to be in your shoes. Hearing the stories that I've heard today, they're heartrending. But I can tell you that there are a lot of people that have given a lot of themselves for this country. There's that old saying of they signed a blank check. up to and including my life. And they've done their thing. They've suffered whatever they've suffered, and now it's up to us to fulfill our part of the bargain with that. And as my friend Larry Seals used to say, that's my story, and I'm sticking to it. John?
Thank you. Thank you. My name is John Butler. I serve on the board of the Atlanta Vietnam Veterans Business Association. I'm actually the chairman emeritus, which is another word to say I'm a has-been. I used to be the chairman, but now I'm a has-been. Actually, I'm here for two reasons. One is to add real quickly. I know you don't want to hear us yammer on and on. I really appreciate all you do, as Skip just said. We've been here listening to all your proceedings for a while, and I wouldn't want to do what you do. So thank you for your service to our state and for our citizens. I appreciate it. And the other thing I was going to add to what he said is that, when we came home from Vietnam, it wasn't a very friendly place to be. But let me tell you something, the same issues, because I deal with younger veterans too, and I'll tell you in a minute why, but the challenges that they face it's surprisingly similar to the challenges that we face, because one day you're getting shot at, and the next day you're in the grocery line, or your wife's sick, or whatever it might be. My wife left me 6 months after we got home, and I don't blame her looking back on it. But you don't think about how to process some of that stuff. We're not very, very poorly equipped to do that, and so we owe it to these young guys, women and men too. The other hat I'm wearing is I'm the chairman of the Atlanta Senior Care Network organization. We have 500 members, all of whom are professional healthcare providers who serve the metro Atlanta, mostly seniors, but adults who have physical and mental and cognitive challenges. That's what we do for a living. I'm retired. I'm 79 also. I'm younger than he is, though. I just turned 79 a little bit, so I'm much younger than he is. But we have 500. The average that we people, clients and patients that we serve. These are home health aides, home health nurses, hospital nurses, case managers, social workers, hospice providers, elder attorneys. I mean, everything you can imagine. Anything that has to do with aging or transitions in life, transitions in the home, for example. We serve an average of about 100 clients a year per person. So we see about 50,000 people in the metro Atlanta area every year. And about 10% of them statistically are veterans. So we see, again, in people's homes often, firsthand, the kind of issues that these veterans struggle with. And I will say, Commissioner Ross, you made a comment about what a wonderful, she is absolutely wonderful. And we have worked together individually, she and I, in many cases, on helping veterans that they're in between they're not necessarily in the cracks, they're in between this kind of service and this kind of service. So we provide our people come together along with her people, and we figure out how to solve, at least sometimes as an emergency situation that has to be dealt with today or tomorrow. And we spend a week sometimes on the Saturday working on some of this stuff. But she's the real deal. And frankly, so are we. We really care about our therapy. I'm sorry, I'm going to preach now. Our therapy really is in the ability that we have to serve and make a difference in the lives of other veterans. That's what we're here about, and that's why we're here today. So anything you can do to help what Commissioner Ross asked for, I will tell you, it means a lot to guys like us, to people like us. That's all the reason we're here. We're out of here. Thank you very much for your service. Thank you for your help.
Yeah. Thank y'all so much. Are there any comments or questions except yay? Thank you. Thank y'all so much. Thank you.
Because I'd really like to.
Yeah, how to contact you. Okay. We'd love to know how to follow up with y'all. It's just and thank y'all for sitting here this long. I know we've got one more presenter, but I really do want to say thank you so much. You did have to listen to a lot.
Well, I will echo what John said. Bless your heart.
Oh, thank you.
Bless your heart.
Thank you. It's an important part of our state budget, though. The people that are here serving, they are dealing with a very important part of our budget that's all people who are very vulnerable, and there's not formula funding for any of it. So we work and we find little money from other people and try to make it work out and get better.
Thank you.
Thank you.
I will
Thank
tell
you.
you, unsolicited advertisement, yeah, I got it. They're on, if you go to the avvba.org website, there is a, I have to tell you, it is a very well done documentary that we produced on our own money about the Vietnam War. It's factual. It's 47 minutes long. Introduced
We'll
by...
make sure they get a copy of it.
Sam Elliott does the introduction for free. You'd be amazed if you have any interest at all in history and actual, not what they blow up smoke, never mind, factual history. Look at that video. Thank you for that.
We'll make sure and get that out to the rest of the committee members too, so they can all see it. I know we're all juggling a couple of meetings this afternoon. Thank you so much. TJ, you still back there? Come on. Thank you for hanging in here with us. I hope you got some other things done back there in the corner. Yeah, we'll put it on. Whichever one you want to go to.
I will be very brief.
Don't worry. Take your time. We're here. We're here.
So much. I'm here. My name is TJ Kaplan, as Madam Chair mentioned. I'm here on behalf of an organization called Imagine Hope. As I believe most of you are familiar, the program is a hepatitis C testing initiative that works in 32 behavioral health sites throughout the state. Thanks to the generosity of this committee and the leadership of Madam Chair, we've been able to expand over the past couple of years. You all appropriated an additional $375,000 in the FY25 budget. Since the inception of the program, we've been able to cure 950 Georgia citizens of hepatitis C. I believe everyone on the committee is aware, because I came and spoke last year, that hepatitis C is it's a deadly disease, but we do have a cure out there, which is a rare thing. We've been able to do that largely through patient assistance programs, which means the cure is at no cost to the state in those situations. So we've been able to make use of that. You'll see on, I believe it's line 15.1.1 in the proposed amended fiscal year 25 budget, the proposal is to replace the $375,000 that you all so generously appropriated last year with other funds. My understanding is that the intention there is to replace the state funding with opioid settlement funds. $250,000 in 2 tranches was awarded to this program in opioid settlement funds over the summer. A point of clarification, it was never the intention of the program for those funds to supplant the state funds, which are what supports the day-to-day operation of the program. Those state funds, that $375,000 that would be removed, is essential to the operation of the program, and I'm here today to request restoration of the funds. And that's it. I'm happy to take any questions.
Are there any questions for TJ? I do not see any. Thank you so much, and thank you, because we know firsthand the great work that Imagine Hope has done. So
yes, ma'am.
Appreciate it.
And thank you to the committee members. Appreciate it.
Thank you all.
Being so patient.
Thank you. And without any further ado, we are adjourned. Thank y'all for hanging in. Thank you.